Next part of microbiology that we'll be starting with is mycology. Now, mycology, as all of you know, deals with what? It deals with all the fungal organisms that you have, and especially after the era of COVID, fungal organisms have become extremely important in all your exam patterns. Now, we are going to divide this chapter in a very logical manner. First, we'll start with the introduction and the classification part. After that, once you've got a basic outline of what exactly the chapter holds for you, we'll be going ahead. We'll be talking about every fungal organism in detail, and we've decided to go system wise. When I say system wise, from superficial to deep fungal infections is what we'll be talking about. So let's begin right away. The first thing that I'll be teaching you is the structure of a fungus, and in that you have two aspects, a cell wall and a cell membrane. Please remember, the cell wall is going to contain chitin. So the cell wall of all the fungal organisms will be containing chitin. Similarly, the cell membrane of all the fungal organisms is going to have ergosterol, but here we have an exception. Please remember, all of them are going to have ergosterol in their cell membrane except one very famous fungus which you must have heard of, and that is Pneumocystis carinii. And there's a very famous other name also that you know it by, and that is Pneumocystis jirovecii. So all of you know that this is a very common infection that you find in HIV positive patients, right? When the CD4 count goes below 200, we'll be talking about it. So this is an opportunistic infection in HIV positive individuals. And what is special about it? That it does not have ergosterol in its cell membrane. Well, this was the basic outline about it. What are we going to go on to next? We are going to start off with the classification based on the morphology. So what do you need to know? There are 4 groups. Now that is how we've classified the entire fungal system. The first group of organisms is known as the yeast. The second one is referred to as yeast-like. The third one is said to be mold or hyphae. And the last one is the most famous out of all of these, and that is the dimorphic fungal organisms. So please remember, yeast, yeast-like, mold and dimorphic. Let's go into that one by one. Let's talk about their details. So when I talk about yeast, the first one that I've put up in this category, yeast. Do you know what you understand by yeast? I'll draw one organism over here and I'll show you a small little bud coming out of it. So in very simple words, please remember, yeast is nothing but the budding form. It's going to show you presence of buds. Apart from that, please remember, there is something known as the second one, that is yeast-like. When I say yeast-like, means the element of yeast has to be there, means there is an organism and it is going to show you the budding, so the element of yeast is there. But apart from that, sometimes these buds become very, very long. So instead of looking like a tiny little bud like this, it's going to look like a long bud, and from which that another bud is going to come out and another bud is going to come out. What is this long buds known as? These are referred to as the pseudohyphae. So when we zoom into these two pictures, all of you can clearly analyze that I have a particular organism and it's showing me a tiny little bud here. So what do I call this? This is said to be the budding form. Whereas now in the next picture you see those tiny buds have become very long. So what would you now want to call them? Now they will be referred to as the pseudohyphae. So please remember that a yeast-like organism is the one that is going to show you both the yeast the phenomenon, that is the budding, and the pseudohyphae, of course. And what are the examples that come under it? So please remember, yeast is going to include Cryptococcus, and yeast-like, which are going to have the pseudohyphae, they will include Candida and Malassezia. These are the two main set of organisms that you have to learn. Repeating, yeast is going to have Cryptococcus and yeast-like will have Candida and Malassezia. Now, there is one information which I want students who are particularly targeting the INI-CET exams, you guys should be knowing, that in the yeast variety, there is another set of organism which is known as Saccharomyces. Now, let me ask you, where else have you studied Saccharomyces cerevisiae? I'm sure you've heard of this particular thing. Where have you read Saccharomyces cerevisiae? So go back to your medicine lectures and even your pathology lectures. Saccharomyces cerevisiae is a very important organism that you have studied in Crohn's disease. And over there in Crohn's disease, you have also studied that there is an antibody called anti-Saccharomyces cerevisiae antibody. So now you exactly know where that Saccharomyces has come from. It's come from the fungus. And which family of fungal organisms? From the yeast, the budding form. Another extra information for the INICET that I want to tell you is a set of two more organisms which are known as Trichosporon and Horte. I'll be teaching you those in a while. Trichosporon and Horte belong to the yeast-like species, means they are going to show you the pseudo hyphae also. Okay, so that was extra information. Now, having discussed the yeast and the yeast-like, having discussed these two, we are going to go ahead and talk about the mold or the hyaline form, the mold hyphae form, and that is exactly what you have to know. So look at what I've written over here. I have eliminated the word pseudo. Now there is no long budding. Now there's actually going to be a long single structure called a hyphae. That is what you have to know. So this hyphae is known as a mold form, and it's of two types. See, one is aseptate, means it's a straight line like this. It's going to be a straight line like this. And the other one is septate. When I say septate, means there are going to be further segments that are present inside it, septa that are present. So let me ask you a question. Which one of these would you call, or what would you categorize this as? So as you can see, there are hyphae, but I can see lines inside it. So which one would I categorize this as? As the septate hyphae, right? Okay, so now having said that, the aseptate hyphae, because as soon as I say aseptate, the COVID era comes up in front of you, because remember the black fungus, remember the mucor. The mucor is aseptate, and mucor belongs to which family? It belongs to the Zygomycetes. So Zygomycetes is a family which has a lot of organisms, but mucor is the hero of the story after COVID, of course. So remember, the mucor is aseptate, so that family, Zygomycetes, comes under it. Comes the tough part, which are all the ones which have septae. And if you see, I have divided further into two categories. One is going to be pheoid and the other is going to be hyaline. What do we mean by that? See, pheoid has the word melanin written in front of it. Means that this is the one that is going to include a pigment. There is going to be some element of pigment. How have I learnt it? I'll tell you in a while. Hyaline, on the other hand, there is not going to be any pigment. So now I'm going to change the, the methodology or the pronunciation a little. So now I'm going to call it melanin. Why am I calling it melanin? And hyaline, I'm going to call it as hyaline. That is how I'm going to change the terminology. I'll call it hyaline, because now remember that under the melanin one, why did I say melanin? Because all the things are going to come under it. Means Piedra, Alternaria, Madurella, Curvularia. These are all the ones which are going to contain melanin or pheoid. So repeating, Piedra, Alternaria, Curvularia, Madurella, AA things. Whereas when I'm talking about hyaline, why did I emphasize on the Y sound of it? Because all the UY sounds are going to come under it. Means what? When I'm talking about the Fusarium, Acrimonium, Penicillium and Aspergillus, so all the UY sounds come together. That's the best way, rather than learning it as mnemonics, which are usually written in other textbooks, and we honestly never tend to remember those mnemonics later on. This is the best one. So remember, whenever they're talking about melanin, all the AA things will come. And whenever they're talking about hyaline septate, all the UU sounds are going to come across with it. Finally, with which we wrap up our third feature also, that is the mold or the hyphae. What are we left with? The fourth one, and that is dimorphic fungus. Now, when I'm talking about dimorphic fungus, and after that I'm going to take you to a recap also. When we talk about dimorphic fungus, the word itself is making a lot of sense over here. That means this is going to exist in two morphologies. There are two morphologies in which it exists. What are those? Both the forms that we studied. Till now, we have studied something known as the yeast form, which is going to have that budding. And the other one is known as the mold or the hyphae form, which is going to be a true hyphae. So there are two forms, and this fungus exists in both. It can exist in a yeast form also, and it can exist in a mold form also. So what do you have to know out here? Remember, yeast is going to be present at 37 degrees centigrade. Mold is going to be present somewhere around 25 degrees. Some books mention 22 to 25. Some mention 25 to 28. So because there's so much of confusion, I've taken up the center value, that is 25. So how do I learn this? Which feature is at which temperature? So remember, the way you say yeast and heat are rhyming. Mold and cold is rhyming. That is how you learn it. So yeast is heat, means it's at a higher temperature, 37. Mold and cold is rhyming, lower temperature, that is 25 degrees. Now, well, having said that, which are the organisms that are going to come under this, that they can form yeast also, they can form mold also? So see, am I not talking too much about temperatures, 37 degree, 25, heat, cold? So that is how you learn. That is the mnemonic. So the mnemonic that you have over here is body heat probably changes shape. Body heat probably changes shape. So what do I mean by that? That now let's start with the answering of these. So B stands for blastomyces. B stands for blastomyces. H stands for histoplasma or histoplasmosis. P is going to actually have two things. P is going to be Penicillium marnefi. P is referred to as Penicillium marnefi. P is also for paracoccidioidomycosis. Paracoccidioidomycosis. Next one, the C. The C is going to be for coccidioidomycosis. And lastly, the S that we have is for sporotrichosis. Sporotrichosis. So let's do a recap over here, guys. When I say body heat probably changes shape, B is going to be for blastomyces, H for histoplasmosis, P for two things, Penicillium marnefi and paracoccidioidomycosis, C for coccidioidomycosis, and S is going to be for sporotrichosis. Now, well, having said that, this is body heat probably changes shape, and easy to learn mnemonic because I'm talking about different temperatures. So the mnemonic is in hand with it. Okay, coming all the way back, that finishes off the classification for us. We have yeast, then we have yeast-like, then we have mold, and then we have dimorphic. Want to do a very quick recap? Yeast is going to have the very famous Cryptococcus for all of us. Yeast-like is going to have the two very famous, that is Candida and Malassezia for us. Then we have mold, that is going to be the hyphae form, which can be of two types. Either it is not going to have septa, which is going to have the hero of the story, that is Mucor zygomycetes, or it is going to be septate. Remember, under septate further there are two varieties. Either it is going to have melanin. So remember, melanin had all Piedra, Curvularia, Madurella, all the AA things. And the other one is going to be hyalene. So that was going to have all the YU sounds, acrimonium, fusarium, all those U sound ones. Coming lastly to the dimorphic fungus, and in dimorphic fungus we have body heat probably changes shape. So these were the organisms that were put up under it. That's a very quick summary of the classification on the morphology that we have done, because here I was only talking about the shapes. Now I'm going to move ahead and talk about the next form, which is based on the spores. So when I say based on the spores, every fungus can either have the presence of sexual spores, that's one possibility, or it is going to have the presence of asexual spores. So there are two things that it can have, that is sexual spores and asexual spores. Now first, learn the mnemonic of any one of them so that the other one becomes easier. So when I say sexual spores, we are going to learn ZABD, or ZAB also is good enough, and everything other than that will come under asexual variety. So how do I learn this? Remember, when I'm talking about the sexual spores, as I just now told you, sexual spores are going to be ZABD. So what is ZABD, and especially ZAB? Means we are talking about zygospores, ascospores, and basidiospores. So what is ZAB? Zygospores, ascospores, basidiospores. Firstly, no points for guessing that zygospores are seen in which family? They are seen in the zygomycetes family. Yes, and don't worry if you don't know the members of it, we will get to know eventually. So zygospores are present in the zygomycetes family. Ascospores are going to be present, A for A, in the Aspergillus, and basidiospores are going to be seen in the presence of Cryptococcus. They are seen in, again, B, C coming together. So basidiospores are seen in Cryptococcus. Let's do a recap. When I'm talking about the three, that is ZABD, we have Z for zygospores, that is zygomycetes, A for ascospores, which is Aspergillus, B for basidiospores, which is seen in Cryptococcus. I have a couple of pictures over here that you can see. So you will obviously see there's a long structure over here, and I can visualize that there are some tiny structures inside it. These are the ascospores, and this will be labeled. So if this is a labeling of an ascospore, which organism will you think of? You'll think of A for A, you'll think of Aspergillus. Similarly, the next one, you can see a basidia and you can see the basidiospores which are coming. As soon as you see basidia, which organism will you think of? You will be thinking about Cryptococcus. So having said that, this was about the ZAB. Why did I call it ZAB-D? There is another family of fungal organisms which are known as fungi imperfecta. Remember, they do not have any sexual state or sexual spores, and that is why they are referred to as fungi imperfecta. Again, something that can come to you as a one-liner if at all. So repeating, when I'm talking about sexual spores, we have the mnemonic ZAB-D, and after this, whatever will be written will come under asexual. So now let me show you all the miscellaneous ones quickly. What all can we see over here? We have something called arthrospores. Now, what are arthrospores? I've got you some pictures. See, there are some pictures which will come without a labeling, which you have to identify. So this picture over here is the photo of arthrospores, and please remember that arthrospores are very, very characteristically seen in coccidioidomycosis. Right now, I am not showing you or giving you any mnemonics, because for all these fungal organisms, I'll give you mnemonics. Then this part of fungal morphology will become very, very simple. Right now, you're just becoming familiar with what all terms we have, right? So yes, coccidioidomycosis, and let me tell you, even dermatophytes, even the dermatophytes are going to show you the arthrospores. But just remember, look at this picture. There's a question you'll find in your Q bank and your PYQs. How do you identify arthrospores? They are condensation of the different fungal elements. It looks as if, if I try to draw it, it will look like this was a fungus hyphae, and that hyphae basically divided into multiple segments. That is the kind of appearance it gives. So very commonly there's a question on arthrospores that comes, that arthrospores is the condensation of hyphal elements. It's the condensation of the different hyphal elements. Go back to your Q bank, you will find this question. Okay, coming to the next, we have something called blastospores, which you just have to know. So I told you, other than ZAB-D, everything is coming over here. So blastospores is here. Then we have sporangiospores. Sporangio is the one on which you get a photo, and you see that on the bottom side. Okay, you can see a sporangiophore, and you can see sporangiospores coming out of it. You can see those round ball-like structures and those sporangiospores inside it. That is something you are going to find in zygomycetes, the same hero mucor wala zygomycetes. So now that gets me to a point of thought, and that is that when we are talking about the zygomycetes, right now only you will say that I had told you a mnemonic called ZAB-D for sexual spores, and I told you that, if I take you back, I told you that zygomycetes is going to show you zygospores, which was a sexual spore. Now, so that I can write that the one type of spore is going to be the zygospores, right? On the other hand, now I'm saying you're also seeing sporangia, so you're also seeing sporangiospores. So can I say this is basically showing you both? This is that one family. This is that one family which is going to show you both the sexual forms also and the asexual forms also. The sexual form is simple. For zygo, it is zygo, that is zygospores, and asexual form is those round structures called sporangiospores. Other than that, where there is something called C for C, chlamydospores. Can you see these spores with a double wall? These spores with a double wall. So that is how you identify the double-walled spores. They are seen in C for C. When I say C for C, we mean Candida. So remember, chlamydospores are seen on candidial infection. And lastly, you have these two things written, conidia, which is macro and micro. So no brownie points for guessing that the macroconidium is going to be large and the microconidium is going to be small. And I'll tell you eventually which organisms show this. So having said that, these are the classification on the basis of the asexual spores that we have. So if I can come all the way back and tell you what all was I going to discuss, like I said, under the sexual spores, we have zygomycetes, we have ascospores, we have the basidiospores, and we have the deuteromycetes, which is basically the fungi imperfecta. After that, arthrospores, blastospores, then we have sporangiospores, then we have chlamydospores, then we have conidia. All the other miscellaneous ones will nicely come under the asexual variety. Having said that, the classification is still not over, right? How do you identify the different vegetative states? Now, this is something again for students who are targeting INI CET, not very important for the NEET and FMG students. It's important more for INI targets. So I can see after the spores, how do they get classified on the basis of the vegetative state? Either they can look like spiral. You can very well see that over here I'm seeing that there is some spiral configuration, or they can have a pectinate body. Pectinate is going to look like a comb basically. Pectinate is looking like a comb. Then there is a chandelier. Everyone's aware of what is a chandelier. Chandelier, the beautiful glass chandeliers that you have in big hotels, the ones that are going to hang like this. So this is also looking like the horn of a deer, antlers horn. Yes, so that is going to look like the beautiful hanging chandelier. Then if it looks like a nodule, you call it a nodular vegetative state. And if it looks like a racket, a tennis racket, then you're going to call it a racket hyphae. So what are the different forms? Let's do that quickly once again. If it's spiral, you name it like that. If it looks like a comb, it is going to be pectinate. If it looks like a hanging chandelier, you call it the same. Round like a nodule, you call it nodular. And if it looks like a tennis racket, you call it a racket hyphae. But is it only about knowing the shape? You need to know which organism shows you what. So you don't have to learn examples of all, but there are some examples that I want you to know. So spiral hyphae is going to be seen in trichophyton, mentagrophytes. I'll be showing you so many trichophyton. Why mentagrophyte? How do I learn that? Because the way you are drawing spiral, spiral is looking like an M, right? The way we had drawn spiral, spiral is looking like an M. So we can call it as mentagrophyte, shows you the spiral hyphae. Next, for pectinate, you don't have to learn an example. For chandelier, so when I said chandelier, so the way you say chandelier, you get the SH sound. Same way when you say Schonleni, so repeating, when you say chandelier versus when you say Schonleni, so trichophyton Schonleni shows you the chandelier form. That is also sorted. Coming on to nodular, you don't need to know. And the last one is going to be what? You are going to have something the toughest, that is epidermophyton flocosum. So remember, epidermophyton flocosum, it has too many F wala sound because I have learnt it as it is racket. I've not shown you the usual tennis racket. I've shown you a racket which you'll find in every Indian household, and that is the racket with which you kill the flies, right? The fly wala racket. So yes, that is what I'm going to teach you. The fly racket is going to be the shape of all the FF organisms, that is epidermophyton flocosum. So epidermophyton flocosum shows the fly racket kind of an appearance. These are the three main ones. Repeating, trichophyton mentagrophytes, M like a spiral. Trichophyton Schonleni, so Schonleni like chandelier. And epidermophyton flocosum, all the F sounds coming. So this is going to look like the fly racket. Okay, all said and done. Let's move on to the next classification that we have, and that is based on the location, the real one that is going to help us in clinical diagnosis. So the first one is going to be involving the superficial mycosis, the superficial layer. What is going to happen under it? There is something known as Tinea versicolor, which we'll be talking about, along with a lot of other tenias. So all the other tenias are going to come under dermatophytes. So we have Tinea versicolor and we have dermatophytes. These are going to be superficial. Then after the skin, we come down to the subcutaneous tissue. Subcutaneous tissue has MRCS. MRCS is one of the famous exams and the toughest exams that we have. So subcutaneous, what is MRCS? M is going to be for mycetoma. R is going to be for the very famous rhinosporidiosis. C is going to be for another very famous organism, that is chromoblastomycosis. And S is going to be for Sporothrix schenki or sporotrichosis. So what is MRCS? A quick recap. M stands for mycetoma, R stands for rhinosporidiosis, C is for chromoblastomycosis, and S is for sporotrichosis. Having said that, now come deeper into the organs, the deep tissues or the systems. And in these, all the dimorphic fungi are going to come. So all the dimorphic fungi, which I just now taught you, if you guys remember, body heat probably changes shape. Yes, all of those are going to come. Other than that, many opportunistic infections are going to come. Like for example, we have Candida, we have Cryptococcus, we have Aspergillus, we have mucormycosis. So all of these remaining ones, basically, in simple words, how I have learnt it is, all the dimorphic fungi, number one, and all these opportunistic infections that we have, All of these are going to involve the organs. They will involve the different systems, right? So now we've done the classification on the location also. Number one, the superficial mycosis. Superficial is all the taenias, taenia versicolor, taenia coming under dermatophytes. Then subcutaneous. Subcutaneous is MRCS. Then the deep ones, deep are dimorphic. Deep are dimorphic and the opportunistic infections. So that wraps up our classification on the basis of the location. Moving forward, we are going to now discuss the laboratory diagnosis. Before we start with the laboratory diagnosis, the first thing that you have to know is sampling. Where will you take the sample from? Now, when I talk about sample, I've got a long list because I can never predict where the fungal infection has occurred. Now, when I talk about the usual sites, yes, hair, we all know hair, skin and nail. Dermatology is going to be very famous. So, these are the samples that will come to you. Fungal infections can come to you with pus. So, maybe they've given you a pus sample. A few ml of pus has come to you for examination. Lung is a very common site. So, if there is a pulmonary involvement, the most common sample that I'm expecting is sputum. If sputum is not available, they might have given me bronchial washings or a bronchoalveolar lavage. And let me tell you, there is one infection in which sputum is not formed. That person is not going to have sputum. That person is going to have dry cough, and that infection is going to be pneumocystis carinii. Pneumocystis carinii, and pneumocystis carinii is definitely going to come. How will you make the diagnosis? If there's no sputum production, you're going to go ahead with a bronchial washing or a bronchoalveolar lavage. Okay, lastly, if nothing works, then you need to go in for a lung biopsy, which is a little rare thing to do. Can be done in cases of certain fungal infections, which I'll talk about in a while. Other than that, there can be blood sample. If there's a meningitis case like cryptococcal meningitis, you'll get a CSF sample. If there's urine or any body fluid involvement, you'll get a sample accordingly. So all said and done, what we mean by this is that depending on the site of or the organ affected, you're going to get the sample. But yes, repeating, some of the most important samples will be hair, skin and nail. Moving forward, what are the different techniques by which we do the detection? So please remember, the first one is going to be the direct examination. Means you are going to just pick up the whatever hair, skin and nail is there, and you're going to look at it under the microscope. Do you know how do we do a direct examination? It is done by something known as a KOH mount. I'll first start with this. I'll first start with a KOH mount. This is how the picture of a KOH mount is going to look like. So first and foremost, what is KOH? KOH is not any stain. It's not any pink, blue, green color stain. KOH is potassium hydroxide. And how much percentage am I using? I'm using a 10 to 20% of potassium hydroxide. Reason, why am I using this? And I can see the picture also. I'm not getting any color. It's a totally transparent kind of a slide. Please remember, this is used because K for K, this is going to digest keratin for me. Potassium, KOH, is going to digest keratin. Why do I want to digest keratin? What kind of samples am I dealing with? I'm dealing with samples like hair, skin and nail, right? When I'm dealing with hair, skin and nail, these samples are the ones which are very, very rich in keratin. Now, if they're very rich in keratin, just imagine a nail. A nail is going to be so thick. How can you just put a nail under the microscope and expect that you'll see a fungus growing inside it? No, you'll have to remove all the keratin from the nail. You will have to digest the keratin. So see, you digested the keratin and then you started seeing beautiful hyphae. Beautiful for us, obviously not for the patient, but yeah, you can see these long beautiful hyphae that are there, but you could only see that once the keratin was removed, and that is exactly what is done over here. Well, having said that, this is about the KOH mount. That was direct examination without putting any colors. The second thing that you'll do is, first you'll start putting some blue, green, pink colors. So let's start with all the stains that we have. The first one, that is quite a famous one, you can suddenly see that the fungal hyphae have become all black, right? So this stain is known as the GMS. This is known as Gomorrhees or Grocot's methenamine silver stain. This is known as Gomorrhea or Grocott methenamine silver stain. Now I'm going to tell you, and I have told you multiple other times also in your path and microbiology lectures, that whenever the word silver comes up in a particular stain, the color that you are going to get is always going to be a black color. So that's a trick which will help you solve so many other things. You must have heard in, do you remember, let me do a very quick recap. Do you remember in your pathology lectures in melanin, have you done a melanin stain, M for M, melanin, Mason, Fontana, silver stain? Again, Mason Fontana silver stain gave what color? It gave a black color. So whenever, and I ask you one more thing from bacteriology, what is the stain for Helicobacter pylori? For Helicobacter pylori, I hope you've been through the bacteriology lectures. Warthin starry silver stain. Again, Warthin starry silver stain gives what color? It gets you a black color, because anything with the word silver is going to get you a black color. So here we have Gomori or Grockout methenamine silver stain for fungus, that gets you a black color. So this was the first stain that we had. The second one that we have is a very usual one. Suddenly they've become all pink. The hyphae have become all pink. So what do I need to know? Please remember P for PAS and P for pink. And what is PAS? If you want to know the full form, PAS stands for periodic acid Schiff. If you're not learning the full form, you're not missing out on much. So let me tell you, periodic acid Schiff is P for P. PAS is going to give a pink color. Coming to the third and the fourth, which I want you to first read and then I want you to ignore. The next two that we have are going to be, there's something known as the gram stain. Gram stain is something I usually do for bacteria, right? Gram positive, gram negative. But please remember, for fungus also, and what is the color? With the gram stain, I'm getting what color? I'm getting a purple color. I'm getting a purple color. This means fungal organisms are gram positive. Fungal organisms are gram positive. Coming to the fourth one, and that is what? We have something known as the very famous. Can you finish micro and path without discussing the famous pink and blue? That is the HNE stain, right? So please remember HNE, you can see all the fungus has become pink and blue. So that is the HNE stain. Well, having discussed it, so all in all, when I go back, there is a black color stain called the Gomori methenamine silver. Then the next one is going to be the PAS or the pink color. Then we have the third and the fourth one, which I told you, read and forget. So what is gram stain? Gram stain is going to give you a purple color, gram positive, and there's an HNE stain. Finally, coming to the fifth one, and the fifth one is known as CFW. What is CFW? It is calco flower white. Now, there is a very interesting mnemonic behind it. Please remember, when I talk about calco flower, the flower word will remind you that this is a fluorescent stain. See, the flower word is reminding you that this is not a regular stain, this is a fluorescent stain. So, can you now see the background is all black? I've got you a black background because it's all dark, and what is going to come up in front of it is something shining. Something is shining. So why is something shining? Because you've used a fluorescent stain, right? But having said that, did you also notice something, that the entire fungus has not become shiny? Only the outline over here and the budding, only the outline part of it over here and over here is becoming shiny. Why so? Outline means what? Outline means cell wall. And have I already told you that what is the cell wall made up of? Go back to the first sentence of this chapter. The cell wall is made up of chitin. So remember, calco flower white binds to chitin. So now the mnemonic is complete, which means the C of calco will remind you of C of chitin. It binds to chitin, that is only the cell wall part. And the floor word will remind you of fluorescent stain. So calco flower white is a fluorescent stain. Coming to the sixth stain that we have, and that is now sixth and seventh. Now let me tell you, there's a very famous organism which you will definitely get a question on, and that is Cryptococcus. And the question will always be related to cryptococcal meningitis, because that's the most common organ that it affects. Now, having said that, please remember, cryptococcal meningitis, a meningitis patient coming to you, what sample will you be taking from the person? We'll be taking a CSF sample. Now, when I talk about a CSF sample, the stain that I'm going to put is a negative stain. First, let me give you examples of it. Negative stain is going to be what? It's India ink and nigrosin. There's a stain called India ink and there's a stain called nigrosin. What do you need to know about these? Why did I call them negative? And the same concept I have taught you in your general microbiology also. Why do we call it negative? Because look at the background. It's actually the background that you are going to stain. The background is stained, and what is not stained? Look at this. What is this white thing coming? Something has not picked up the stain. That is the capsule of Cryptococcus. That is the capsule of Cryptococcus. That is what I wanted to tell you. Cryptococcus is a capsulated organism, and that capsule is very, very weird. You know, you try to give it any pink, blue, green color, capsule doesn't take any stain, it doesn't take any color. As a result of which, what happens is you will have to do the opposite approach. So I don't know whether you guys are pretty young and don't belong to our generation, but long back when you didn't have too many phones to click photographs, we used to take photographs with a camera and a Polaroid, and we used to have a reel, and the reel used to then print out a lot of negatives. Maybe you've seen that with your parents. Makes me feel a little old while I say that to you. But yeah, negatives, the concept, I'm sure everyone's seen it. The concept of negatives was that the background was dark and the person's photo was coming highlighted out, right? The same thing is happening in a negative stain. That is, the background is coming out to be dark, and what is highlighted is the cryptococcal capsule. That is, if you received a CSF sample, that's the trick over here. What if the person had a biopsy done? Not a CSF sample, but what if the person had a biopsy done? So please remember, if you will receive a biopsy like cryptococcal meningitis or brain biopsy, or maybe cryptococcus has affected the lungs, so lung biopsy. If you ever get a biopsy, then what stain will you use for cryptococcus? Then for the same cryptococcus, I won't be using India ink. I will be using this nice rose, reddish, pinkish color stain, and that is known as Mycology. This stain is referred to as Mycology. So that is the 7th stain that you have done. So remember, for cryptococcus, reading what sample has been given to me is very important. If they have given you an India ink or a negative, or they've given you a CSF sample, then you go in for India ink or nigrosin. But if they've given you a biopsy sample, then you go ahead with Mycology. Having said that, these were all the different stains that you had. So coming back, first you did direct examination with KOH, then you went ahead with stains. Let's do a quick recap. The black color stain was Gomori methenamine silver. The pink color stain was P for pass. So pass was positive. For cryptococcus, we had the negative stains if you were talking about the CSF sample. For cryptococcus, you had Mycology if you were talking about the biopsy sample. And 2 miscellaneous ones were gram positivity and HNE stain. So that wraps up all the stains for us. Now coming to the third one, and that is a culture, and this is a previous year question, very, very important for all of you. So what is the culture that we use? The very famous Sabauroud's dextrose agar, that is SDA. Sabauroud's dextrose agar, or SDA, let's dissect it, is obviously going to contain dextrose, there's no doubt about it. The way you write SDA, the question that has come in your previous years is that what is the pH at which you are going to deal with it? So remember, the way you write S, it either looks like a 5 or a 6. So I've clubbed it. It is a pH of 5.6. The basic concept is that they ask you that this is an acidic pH. Okay, we require an acidic pH. Repeating once again, the way you write SDA is going to be a 5 or 6. 5.6 is the pH that is there. Apart from that, I have noticed that SDA has antibiotics also. What antibiotics? Gentamicin, chloramphenicol have been added. Why? So that it can inhibit or kill the surrounding bacteria. For the killing or the inhibition of the bacteria, I have added antibiotics. Apart from that, we can also have chlorheximide, cycloheximide added. Why do we have cycloheximide added? So please remember, you also want to finish off other saprophytic fungi. You don't want any saprophytic fungi to grow. You only want your pathogenic fungi to grow. So you basically want to get rid of 2 things. Number 1, you want to get rid of the bacteria. So for bacteria killing, you are going to give antibiotics. Second, you want to get rid of the saprophytic fungi. So for that, you're going to have cycloheximide. So these are questions that you get. Which antibiotics are you using? Gentamicin and chloramphenicol. Which, agent for killing the saprophytic fungi are you using? Cycloheximide. What is the pH? Something acidic, 5.6. And obviously the name has dextrose in it. So Sabauroud's dextrose will obviously have dextrose in it. Okay, having said that, now the next technique that I'm going to do is I'm going to take a little bit of this culture with a loop, and I say I want to look at it under the microscope. That is the next thing that I desire to do. So what am I going to do? Repeating once again, I am going to take a little bit of that sample from here, and I'm going to look at it under the microscope. Whenever I look at anything under the microscope, I need a stain, and that is a blue color stain called lactophenol cotton blue. What do we need to know about it? So there are, as the name suggests, lacto, phenol, cotton blue. So when I say lacto, means lactic acid has been used. Why has lactic acid been used? Lactic acid is going to help in preventing or preserving the morphology of the fungus. Lactic acid is going to help in preserving the morphology of the fungus. Okay, when I say lacto, then next is phenol. So why have we added phenol? I think everyone knows phenol is a disinfectant. Yes, so you want all the other miscellaneous things to be killed. So yes, you're adding a disinfectant along with phenol. We also have glycerol. Glycerol is something, the name doesn't have it, but please remember, glycerol is something, glycerol adds a little bit of water. When I say that it adds a little bit of water, it is something which is going to be hygroscopic. That is the description given to it. When I say hygroscopic, means anything that is going to prevent drying. Anything that is going to prevent drying, because it's providing that hygroscopic, that water ability, that is glycerol. So remember that, because it's not in the name. We only call it lactophenol cotton blue, but it also has glycerol. And finally, you have cotton blue. What is cotton blue? Cotton blue is the dye. Cotton blue is the one that is actually going to add the color to it, the blue color, and you can see that under the microscope. Finally, the color that you got is a blue color. So let's repeat. When I say lacto, phenol, cotton blue, lacto is for preserving morphology, phenol is a disinfectant, we studied it, glycerol is another thing that we have which is going to give all the water and prevent the drying, and cotton blue will give the color. So tell me, are you putting lactophenol? Now comes the real question, so make a table around it. Are you putting lactophenol cotton blue directly onto the sample? No. You are first growing the sample on a culture plate. From the culture plate, you are taking the sample and putting lactophenol cotton blue. So it is used for studying culture morphology, and that has been one of the most famous questions of the previous years. What is the stain used for studying culture morphology? It is lactophenol cotton blue. Well, having said that, almost coming towards the end of the culture media. So the main culture media was obviously SDA. But if I do a little bit of twists and turns, there is another culture media called the corn meal agar. And now I'm going to tell you the story of the 3 C's. So when we talk about corn meal agar, you know in which situation will you use it? When I want to grow chlamydospores. When I want to grow chlamydospores, that is exactly when I use corn meal agar. And I've already told you chlamydospores are grown or are grown by which particular organism? Candida. So repeating once again, when I'm talking about corn meal agar, I grow chlamydospores in it, and which organism shows you that? Candida shows you that. So that's another agar that you have to know. Then, because we are talking about Candida, I'll add another C onto that Candida, because Candida is also grown on another agar known as the chrome agar. Candida is also grown on chrome agar. So that will tell you chrome. Chrome means what? Multicolored. You're going to get an agar with a lot of colors. So again, C for C. Chrome agar is something that you grow. Candida, and you can see Candida tropicalis, albicans, cruzi, so many other things written. Do you have to learn these colors? No, you don't. You just have to know that yes, there is a Candida, and that Candida is basically grown on this colorful media. Okay, coming to the last one, suddenly everything's going to become black. So you either call it a bird seed agar or you call it a bird seed Niger agar. And why so? Because Niger word is going to tell you about that brownish blackish color. And this is very famous. I'm not telling you the pathophysiology behind it right now, but this is very famous for Cryptococcus. How to learn this? What is going to be the mnemonic? What is the story of Cryptococcus? We'll come to that. It has something to do with birds. So yes, you will be able to learn it very, very easily. But for the time being, remember, if I see a brownish color Niger, brownish color agar, that's a bird seed Niger agar seen with Cryptococcus. Well, having said that, if we want to do a very, very quick recap of whatever we have studied up till now, and that is something that I've introduced in these lectures, because I feel that there are some topics which are very image heavy. So while you study, you feel you've analyzed it well, but towards the end, you obviously feel that you need a quick summary of a minute or two so that everything that you studied in the past 15-20 minutes can be summarized quickly. This is what is going to help me. So if I show you all the pictures of what we have studied up till now, what is that modality which is going to give you that black color? I think everyone knows black color is going to be with gomori, methenamine, silver stain. So like I said, the black color is always going to be something with silver. So gomori, methenamine, silver stain. Okay, coming to the next, suddenly it becomes everything pink. So P for pink, and you're going to get what? P for pass. So we are going to now label it as pass. P for pink, P for pass. Coming to next, something is becoming fluorescent. As soon as we say fluorescent, we are going to use calco flower white. Remember, flower had the word fluorescent, calco flower white. Look at the next three. The next three are for the same organism, and that is Cryptococcus. What do we need to know about Cryptococcus and this? The first one must have been the CSF sample, because I'm using negative stain. I'm using India ink negative stain. The second one must have been a biopsy sample, because I have something red in color, and that is going to be mucicarmine. And like I told you, what is the agar? Something to do with birds and black, right? So there is a bird seed Niger agar. There is a bird seed Niger agar that we have, that sums up the entire story of Cryptococcus. Okay, what is the usual agar that we use? So yes, the first picture out here, the first picture is going to be the SDA, right? The Sabauroud's dextrose agar. Remember what was the pH? The pH was 5.6. And from that SDA, if I want to grow something as a culture morphology, so for culture morphology, the blue color stain that we use is lactophenol cotton blue. Finally, coming to the colorful media, which is the one that requires a colorful media. So this is known as the chrome agar. Chrome because it has so many colors, and C for C, chrome agar is very, very important when it comes to Candida diagnosis. So yes, this is one slide which wraps up everything that you have studied up till now in this chapter in the most concise manner. And before I make you practice a few questions, please remember, coming all the way back, you have done the culture, but there are some other things also that you can do. You can do antibody testing. That is one thing. You can do skin tests, which are not very commonly done, but like you had skin test for TB, skin test for leprosy and others, similarly for fungal organisms also you have skin tests. And lastly, something that you can do possibly anywhere starting from bacteria, virus and then fungus also is a polymerase chain reaction. So nothing very fancy about these three things that I had to tell you, but yeah, the direct examination with KOH, the stains and the cultures, those are the most important. Let's do a quick recap, and also now let's practice one or two questions which might help you. So that is a question that is going to help you now. There's a patient who's presented with scaly skin, redness, irritation and small blisters all over his skin. The doctor suspected fungal infection and sent his skin scrapings to the laboratory. Which culture media is useful for culturing the fungus? So firstly, even if you would have read the last sentence, which culture media is used for culturing the fungus, you know for a fact that for fungal organisms, the culture media is SDA. But obviously, the purpose of this question is not this. You have to tell me the others also, because by now I'm assuming you've heard throughout the bacteriology section also. So when I talk about potassium tellurite agar, do you all remember this was a selective media? This was a selective media that you had for what? This was a selective media for Corynebacterium diphtheria, right? Yaad aa gaya? Okay. When we say triple N, for triple N, I had told you NNN media is used in two things. Number one, it is Leishmania, that is Kala Azar, and the other one is going to be Trypanosoma cruzi. So I hope you remember Leishmania was the organism causing Kala Azar, and Trypanosoma cruzi was the organism that was causing Chagas disease, and for both of these we had NNN medium. Lastly, coming to chocolate agar, can be used in so many things, but one place where it was important was Haemophilus influenza. Do you remember that concept of satellitism? So yes, Haemophilus influenza can definitely be grown on a chocolate agar. So over here, because fungus was asked, your answer is simple. It's going to be SDA. Coming on to another question that we have, which of the following is not dimorphic? First, you will have to learn and recall which were the dimorphic fungi, and now you will be learning which of them is not dimorphic. So please remember, we had a mnemonic, right? Body, heat, probably changes shape. Can you do a quick recap with me? B was for blastomyces. H was for histoplasmosis. P is for Penicillium marnefi. So something to do with marnefi, Penicillium marnefi was mentioned. Next we have paracoccidioidomycosis. Then we have coccidioidomycosis, and then we have Sporothrix schenki or sporotrichosis. So what do we have to know? Now once again, Talaromyces marnefi. See, whether you call it Talaromyces marnefi or Penicillium marnefi, it's the same. So is this a dimorphic fungus? Yes. Coming to Sporothrix schenki sporotrichosis, is that a dimorphic fungus? Yes. Histoplasmosis or Histoplasma capsulatum? Yes. So which of them is not dimorphic was the question, and not dimorphic is Cryptococcus neoformans, because I think everyone remembers Cryptococcus was the yeast form. When I say yeast form, means Cryptococcus was the one that was showing me budding. So the answer over here is option B. Yes, with that, we wrap up our discussion of the introductory part of mycology. Now we are going to start off with the next portion, and that is the superficial and the subcutaneous mycosis, which you've already studied in the classification. Now we are going to go into the details. Starting with the next part, and that is the superficial and the subcutaneous mycosis. I hope by now all of you are aware and you've done your introductory portion well. Superficial had everything that was to do with tinea versicolor, the different types of tinea as well as the dermatophytes. So that is exactly what we are starting with first. And after that, the subcutaneous mycosis had the very famous mnemonic, that is MRCS. So the entire target of this section is going to be this. So starting first with, as I said, tinea versicolor. And what is the other thing about tinea versicolor that all of us should be knowing? The name of the organism, and that is Malassezia furfur. So yes, Malassezia furfur. There are other species of Malassezia also which might be there, but most importantly, you have to know furfur only. And if I ask you from dermatology point of view, how does this tinea versicolor present? In some of the books, it is also written as pityriasis versicolor. So that also stands for the same thing. And if you look at it under the the clinical spectrum, you can zoom into this picture and have a look at this. On the back, you will easily visualize that the patient is having these hypopigmented lesions, right? So on the back, on the trunk, hypopigmented lesions are there. Scales may be present which are not very readily visible. So the most important part that you have to know is that there are going to be hypopigmented lesions, and very commonly they are seen on the trunk or they are seen on the back. So these are common sites. And under wood lamp, so I hope you all remember in dermatology, for everything we do a wood lamp examination. So under wood lamp examination means using a UV light. Wood lamp examination is done using a UV light, and we get to see a yellow fluorescence. There is a yellow fluorescence that is noted. And how have I learned it? Is because now that we are talking about something yellow in dermatology, let's think of a yellow color fruit that we have, and that can be our microbiology. So what is the yellow color fruit? So what you do, that you're going to take skin scrapings to make the diagnosis. I'm going to take skin scrapings, and from these scrapings, I'm going to look at it under which mount is this? I've not added any color. Which mount is it? This is the very, very famous KOH mount. So remember, I told you we'll use a 10 to 20% of KOH mount. And as soon as I saw KOH mount, before I start with that, where have you read tinea versicolor or Malassezia furfur? Which part of your classification was it there? Is it yeast? Is it yeast-like? So I hope you all remember that Malassezia furfur was a yeast-like organism. Whenever I say something is a yeast-like organism, means it's going to have budding form also, and it is going to have the pseudo-hyphae also. And if you remember this information, now let me go on to it. When I say budding, means there is going to be a bunch of something that is budding. So if we draw it out again, there's going to be a bunch of something that is going to be budding. Isn't it looking like grapes? So these are all the buds. And then we have something which is going lengthy like this, and these are going to be the pseudohyphae. So this is looking like a banana. So can I call it the banana and grapes appearance if you're vegetarian? But if you're non-vegetarian, then to the buds, you're going to call the buds as the meatball. You're going to call it as the meatball, and these are going to be the budding form of it. And all the lengthy one, you're going to call it as spaghetti pasta. So many food items that I have ruined for all of you. So now let's look at it. So first and foremost, this is known as the spaghetti and meatball appearance. This is known as the spaghetti and meatball appearance. If you're vegetarian, this is known as the banana and grapes appearance. So have a look at this picture. Firstly, it's a KOH mount because it doesn't have any color. If you zoom into it, you can see those lengthy pseudohyphae, the lengthy structures. Yes, so that becomes the spaghetti pasta. And you can also see that bunch of buds, that is the meatball. So that is why you called it spaghetti and meatball. There's another meatball down here. So spaghetti and meatball appearance, or banana and grapes appearance. Okay, there's not the end. There's one more food item that I'm going to ruin for you. And that is when you look at it under culture. When you want to culture it, I think everyone knows by now that the culture that we'll be using everywhere is going to be the SDA. SDA, Subaurus dextrosagar. But there's something different about Malassezia. Malassezia is a lipophilic organism. If you try to grow it in a regular SDA, you won't be able to grow it. You will have to add something. Olive oil. Why did I say olive oil? Because olive oil is fatty, lipo, so it will need that fatty source. Only then it is going to grow. Okay. So remember, when you have SDA with oil obviously you will fry something. So what you get is the very famous fried egg colonies. We get the presence of fried egg colonies. You can see over here, we can zoom in once again and find out these are the different fried egg colonies that you have. They look exactly like the way you fry a sunny side up or a fried egg that you see over here. So well, having said that, now I think everyone knows that if I'm dealing with a colony, I might want to pick up that colony and I might want to look at it under the microscope. What did I teach you? What do we use for culture morphology? What stain is used? So for culture morphology, the stain used is lactophenol cotton blue. And lactophenol cotton blue is showing you the same spaghetti and meatball. See, the lengthy ones are the spaghetti and the round one clusters are going to be the meatball. So every kind of stain that you may put, the appearance will always be the same. Whether you put a KOH mount or you put an LPCB, you will always get a spaghetti and meatball appearance. So now, having said that, before I summarize this entire thing, so which are the other places that you see the very famous spaghetti and meatball appearance? Where do we see the spaghetti and meatball appearance? And that is going to be first place, which I've just taught you right now, that is Malassezia furfur. And the second one is a pap smear finding that you have studied in pathology. If you remember very well, there was a condition called trichomonas and leptothrix. There was a condition called trichomonas and leptothrix. So remember, trichomonas over there was looking like the meatball and leptothrix was looking over there like the spaghetti pasta. So if you remembered it, very good. If not, it's time to revisit the pathology lectures. So that was the first correlation. What other do you need to correlate? There is also something referred to as so many fried egg appearances that you have both in path and micro. So where all do you get to see the different fried egg appearances? Please remember, let's divide it chapter wise or rather subject wise. When I'm talking about microbiology, which we are studying right now, there are 2 M colonies which are fried egg. The first one we've done right now, that is Malassezia furfur, and I hope you also remember your bacteriology section where mycoplasma colonies are also fried egg. The second one, let's talk about what all did you study in pathology. So when we talk about pathology, is there any brain tumor? I think you all remember I gave you a method also of learning, that is the brain tumor with all the O's, oligodendroglioma. Oligodendroglioma, that is going to have the eggs in it. Then when we came down to discussing the testicular and the ovarian tumors, we had studied that seminoma, and obviously that's in the testis. The same thing that we talk about in the ovary is going to be dysgerminoma. So all these ones are also going to have, and also one very important thing, bone marrow biopsy of hairy cell leukemia. Remember, again, I had taught you bone marrow biopsy. So yes, these are all the fried egg appearances that are going to help you. Let's do a very quick recap. For microbiology, we have the 2 M colonies, that is Malassezia furfur and mycoplasma. For pathology, brain tumor oligodendroglioma, testicular and ovarian tumor seminoma, dysgerminoma, and on a bone marrow biopsy of hairy cell leukemia. Coming back, now it's time for us to, like I said, after every bacteria, virus, protozoa and fungus, we summarize things. So here you have in front of you the classical summary of Malassezia furfur. What do you need to know? Point number 1, what kind of lesions? We have the very famous hypopigmented lesions. Next, what are you going to see under the microscope? We'll see the, again, very famous, lot of food items coming. So spaghetti and meatball appearance. And if we are vegetarian, then we call it as the banana and grapes appearance. Coming to the next one, we see what kind of colonies? We see the very famous fried egg colonies. If I want to fry the eggs, I need oil, right? So I can't put a regular SDA, I will need a regular SDA with a little bit of olive oil so that I can fry the eggs. That's the entire summary that you have for Malassezia furfur. So this was the first part. After this, which was the other superficial infection that I told you we'll be discussing? Before that, also one more thing that I want to tell you, since we're discussing all the fungal organisms, we'll alongside also talk about their treatments. So when I'm talking about Tinea versicolor, you have a topical treatment and a systemic treatment. So for topical treatment, there are a couple of ointments available, sulfur ointments, or there are imidazole creams that are available. And for systemic, you have the azoles, that is, we have itraconazole, fluconazole. So usually one or both of them are given as a combination of topical treatments and systemic therapy. Well, having discussed this, now before I go on to the other, the main dermatophytes, there are quick other tenias that I want to discuss. There is one tenia which is known as Tinea nigra. So what we discussed up till now was Tinea versicolor. Now I come to Tinea nigra. As soon as I use the word nigra, there is going to be some element of brown or black that is going to come up in front of you. Niger word, na? And look at these three pictures. Beautiful. I don't need any description further. Niger word means something brown, black. So look at the picture that you have of a lesion on the palm. Look at the picture of a lesion that you have on the soles. And when you decided to do a KOH mount, see, I always told you KOH was what? KOH was no color. It was just a chemical, right? But suddenly, even with KOH, you are seeing you're not supposed to see a color, but you're still seeing the brown color. Why? Because the fungus itself has a brown color. So whether it occurs on the palms or the soles, or whether you see it under microscope, the brown color is always going to be there. And the organism that we are talking about is Hortae wernicki. So now there's a trick that I'm going to tell you for fungal organisms. Where all will you get this brownish, blackish color? So see, whenever you heat something, if you overheat a pizza or any food item, everything starts becoming black or brown. So wherever the word Hortae or wherever the word hot will come, something black is going to come. So like over here, you're saying Hortae wernicki. So Hortae wernicki causes something hot means black. So some black is going to occur. That is why we are talking about Tinea nigra. Also, please remember Hortae is halophilic. When I say halophilic, it is going to be something that is salt loving. That is why it is seen in the fishermen. Fishermen, the salty water, the salty sand. So remember, it is halophilic. That is why it is seen in the fishermen. And for treatment, we have the imidazole topical creams that are available, that are put on where? The palms and the soles. Whatever I have shown you is the thing. Means the most common location is going to be the palms and the soles. Okay, now having said this, moving away from the skin, now we go a little bit into the hair, and that is pedra. When I say pedra, we have two things. These are quick things that I'm revising from dermatology, right? We have something which is referred to as white pedra, and we have something called black pedra, both affecting the hair. But you can see the white pedra is going to come across as white dots, and black pedra is going to be as black dots. So which organism causes it? So please remember, white pedra is caused by Trichosporon beigeli, and black pedra is caused by Piedra hortae. How do I learn this? Very simple. See, I told you as soon as anything to do with hortae will come, means the color is going to become brown black. So when they say black pedra, so pedra word remains as it is, but instead of black, I can add the word hortae. So Piedra hortae will cause the black pedra, and Trichosporon beigeli is how you say it, but I will call it bijli. I hope everyone understands that much of Hindi, that bijli is what is going to be lighting. Right? So yes, the lighting, bijli is obviously white in color. The bijli is going to be white in color, right? So when I say bijli, I'm talking about white piedra. When I say hot, I'm going to talk about black piedra. That is something that is important. Having said that, now let's move on to what is the treatment. So if there's a hair follicle affected with black or white piedra, what do? First is cut and shave the hair. The first thing that you have to do is cut or shave the hair, and along with that, you give the same like you were giving for Tinea nigra, also the same, that is topical imidazole creams are given after cutting and shaving the hair. Okay, now moving on, having discussed all these tinea, we still have a few left, because now we are going to go on to the next family, that is dermatophytosis. Dermatophytosis, also known as tenaeasis, lots of tinea. So there is, how you read this, students often confuse it. Tinea is the name of a disease. Tinea is caused by many organisms, and the name of those organisms I will be teaching you now. But if I say tenaeasis or dermatophytosis, that's the overall spectrum name of the disease. So when I talk about tenaeasis, there are three organisms which are written as TME. Now remember, TME is a very famous short form. If you ever type Telegram URL is TME, right? So for Telegram you have TME. So remember, T for trichophyton, M for microsporum, and E for epidermophyton. Trichophyton, microsporum, and epidermophyton. epidermophyton. That is what you have to know. So TME, and I'm telling you to learn it again and again in the same order, and I'll tell you why in exactly a few minutes when I tell you a mnemonic. Having said that, before I go into each one of them individually, trichophyton, microsporum, epidermophyton, some of them are found as human to human, some of them are found in the environment, some of them are found in animals. So how do I get to know? There's a very, very lengthy and tough classification that I'm going to show you now. So anthropophilic to do obviously with humans, zoophilic to do with animals, and geophilic to do with the geography and the environment. So how am I going to learn this? So see, when I say T, see all these T's and E's, you know, T's are all trichophytons, M's are going to be microsporums, if there's E, there's going to be epidermophyton. So basically all the T, M, E I know, but what words ahead of it? So see, trichophyton terrestriae, trichophyton gypsum, these are geophilic. How do I learn this? Geo reminds me of geography. What is in the geography? What is in the environment? Gypsum is in the environment. Terrestrial is also to do with the geography and the environment, nature. So terrestrial, extraterrestrial, gypsum, all these are things to do with geography, environment. So I put them under geophilic. Next, when I talk about zoophilic, zoo has to remind me of all the animals. So equinum, whether it is trichophyton equinum or it is microsporum equinum. Equinum reminds me of horses. So horse is going to come under the zoophilic. Then canis will remind me of dogs. That is also going to come. And verrucosum. So I have learned veru as sheru. Sheru is the usual Indian famous name given to most of the dogs and most of the pet animals. So remember the equinum, the canis, which dog? Sheru dog. So veru, sheru, verrucosum, all these are going to come under the animals. After that, whatever may be written, that is rubrum, tonsurans, schonleni, violaceum, auduni, all of these are coming under the anthropophilic. So that's the only way of learning this. I've tried so many ways otherwise, but that's the best possible way that I can come across. Repeating once again, when we are talking about, let's do a quick mnemonic. When we are talking about geography, we are talking about terrestrial and gypsum. When we are talking about the animals, then the horse, that is equinum, the dog, that is canis, and sheru dog, that is verrucosum. And after that, whatever will be left will come under the anthropophilic. Just one word. When we are talking about this Taenia rubrum, just as telling you as a side question, because you might see this in many of the, the grand tests and PYQ banks. Taenia rubrum is very famous for causing nail infection. Nail infection is very common. Nail infection is known as what? It is known as onychomycosis, right? So one of the trichophytons which is very famous for causing this nail infection is going to be trichophyton rubrum. And if they ask you, okay, there's trichophyton rubrum causing nail infection, what category does it come under? It comes under anthropophilic. Having discussed it, now coming back, whether it is trichophyton or microsporum or epidermophyton, at the end of the day, what it's going to cause is teniasis. So let me start with the clinical aspect of the disease, that is teniasis. Then I'll take you gradually into the organism. So I've got you all the infections of the head and the scalp in one side. So we've got something called Taenia capitis. When I say capitis, cap will refer to the scalp, right? So this over here is going to be a case of Taenia capitis. Capitis means cap and scalp. Okay, you can see these patches, but suddenly on these patches, if I say that there is some crust formation, you can see if you zoom in carefully, can you see in the next picture, you're seeing some crusting over here and some crusting over here. So if you start seeing crust formation, that is known as crust or scutula. That is known as crust or scutula. That is known as Taenia favus. Now remember, I have learned Taenia favus. Favus means flakes and flakes means crust. So that is how I have learnt it, that favus is the one that is going to cause all the flaky things, the crusting things known as scutula, and S for scutula or SC for scutula, SC for Schonleni. Exactly which trichophyton causes it? Trichophyton Schonleni causes it. So remember, SC for scutula, and SC for Schonleni. Coming to the next, now suddenly the scalp is going to become like a, a round swelling, a ball, ping pong ball kind of swelling. That is a carrion. Carrion is something which is defined as a boggy swelling and is an examiner's favorite. It's one of the most famous previous year questions. So, carrion can be caused by mentagrophytes, it can be caused by verrucosum. These are just few examples of how the different organisms can cause it. So, simple. When I'm talking about the scalp, let's zoom into these pictures and see. If I give you this picture, it was only occurring as a simple lesion on the scalp. It is capitis. If I end up putting a little bit of crusts and flakes into it, then I will call it what? I will call it scutula. This is going to be tinea favis, means flakes and crusts have been put. If I convert it into a boggy swelling, then we are going to refer to it as a carrion. So what you have over here is a carrion. Okay, having said that, so I can put a tick mark to all the head related things. Now let's come to the face and the body. Let's go by common sense. If I say there is a tinea involving the face, what tinea will you call it? Tinea facie will obviously involve the face. If I say someone's beard is getting affected, so tinea barbae. Tinea barbae is what is going to be beard involvement. If I say there is a trunk involvement, trunk means, what is the meaning of the word corporis? Corporis means trunk. And if I say imbricata, imbric, concentric. So if I see concentric lesions, it is tinea imbricata. Let me show you some pictures. See, look over here. Over here, the patient's trunk is getting affected. Trunk basically refers to corporis. So, when I see the presence of tinea corporis, I will see these fungal, classical, ring-like fungal infections. These are going to be on the trunk, so that is tinea corporis. But if I make that a little concentric, can you see? There are these concentric circles. So, there's a very simple way of learning it, that when it is concentric, it is imbric. That is, it is tinea imbricata, which is going to show you concentric circles. Okay, having said that, coming to the next. So, we've done all the head related things, we've done all the face and the trunk related things. Now let's go on to a little more common sense kind of a thing. When I say tinea unguum, what is the meaning of unguum? Unguum refers to nail, right? So if there is involvement of nail bed, have a look at this picture. Like I said, unguum basically means that there's going to be involvement of the nails, and that you can very well visualize over here. Again, a common sense thing. Coming to the next one, when we talk about tinea cruris, what is the meaning of cruris? Cruris means groin. So when there is involvement of the groin, we call it tinea cruris, and this is very commonly seen in the dhobis, or it is also known as, because there is constant exposure to moist water. So there is dhobi itch, or people who tend to, itch a lot, or there's closed clothes, forever they are wearing tight clothes. So jock itch, remember the jock, that is the area where the, the underclothes are worn. So jock itch as well as the dhobi itch, they are all referring to the groin area. Groin area referred to as the cruris. Lastly, no points for guessing. What is tinea pedis? Pedis means pedia, means the foot is going to be affected, very commonly known as athlete's foot. So that brings you down to a summary of everything which I'm going to quickly recall. And that I'm going to recall with what? With the help of direct photos. So quickly tell me, the first one over here was capitis, because there is involvement of the scalp. If there is involvement of flakes, that is you call as tinea favis. So this means there are flakes, or there is scutula over here. Then we said there's a boggy swelling. The boggy swelling was said to be carrion. That was famous. Then if there is involvement of the nail bed, it is known as tinea unguum. Unguum for nail bed. If there is involvement of the trunk, we refer to it as what? We refer it to as tinea corporis. And if there are any concentric lesions, so concentric was known as tinea imbric, that is imbricata, tinea imbricata. Other than that, so for feet you had pedis, for the groin you had cruris, for the face you had facie, for the beard you had barbae. These were all the names which were self-explanatory. Okay, all said and done. Out of all of these, I've only been focusing too much on obviously the skin part of it. If I go into a little bit of hair infection, which is actually a little tougher part, that is what I'll be talking about next. So if you go all the way back, guys, to the first part where I told you the introduction of the sexual and the asexual spores, over there you are going to analyze that there was something known as the arthrospores, and arthrospores were coming under the asexual spores, if you remember. And also please remember, I told you arthrospores are present in two places, coccidioidomycosis, which I'm yet to teach you, and the other one was the dermatophytes. So yes, now I'm going to talk about the dermatophytes, and please remember, you can see there's something called ectothrix and there is something called endothrix, and the name is explanatory. Now see, if these arthrospores are outside the hair shaft, if the arthrospores are outside the hair shaft, it is ectothrix. If you see the arthrospores inside the hair shaft, they are going to be endothrix. So now all that you need to know. So if you see the arthrospores outside, it is ectotrichs. If you see them inside, they are going to be endotrichs. Now you need to know which organisms come under what. Organisms are still the same. TME, Trichophyton, Microsporum, Epidermophyton. Organisms are still the same. Now you just need to visualize them. So what are you going to know now? See, what are the things that always roam outside? So remember, canis, dogs. Canis or dogs, they are always going to roam outside. Also, Microsporum audini. Now, if you buy an Audi car, if you buy an Audi car, obviously you are going to show off and roam around outside, right? So remember, for outside, for ectotrichs, either you will learn about the dog, which is canis, which will always go out, or audini, that is Audi car, which is always going to be on the road for show off. Whereas if you want to roam around inside your colony, which is the best vehicle, which a lot of you will agree with me, the best vehicle to roam around in your own colony and especially in traffic cities, that is TVS Scooty. TVS Scooty inside, if you want to roam around inside in your locality, TVS Scooty is the best. So remember, that is Trichophyton tonsurens, Trichophyton violaceum and Trichophyton schonlini. I know it's tough, but that's the only story I could think of. So remember, when you're talking about tonsurens, violaceum and schonlini, the TVS Scooty is going to help you roam inside, so it will show you endotrichs. Whereas when you're talking about Microsporum canis and audini, so remember the dog and Audi will be for show off outside. So that is going to be the ectotrichs. Having discussed this, now let's move on and talk about the different organisms and how they are going to look under the microscope. So when I'm talking about dermatophytes, the first thing I told you was we'll be dealing with Trichophyton, Microsporum and Epidermophyton, right? Now, before I go into how you're going to see them under the microscope, let me tell you the clinical features. So I'll take you all the way back and talk about the classification first. So this is what you had: Trichophyton, Microsporum and Epidermophyton. All of them are under dermatophytes, which means that skin involvement is going to occur with each one of them. Skin is mandatory that the skin infection will be there. Other than skin infection, please remember, when I say tricho, tri means all three things: skin, hair and nails. Because there are three things in dermatology, right? Skin, hair and nails. So in tricho, all tri will be affected. In Microsporum, it is skin and hair. And in Epidermophyton, it is skin and nails. And how will I remember? Because here the confusion will occur. So remember, Epidermophyton, the one that is ending with N, that is going to have the nails in it. So remember, Epidermophyton will have the nails and Microsporum will have the hair. So simple. When I'm talking about Trichophyton, all tri, skin, hair, nails. Microsporum, skin and hair. Epidermophyton, skin and nails. Having said that, now we come back to this mnemonic. Why did I say TME? Because now I'm going to tell you that to differentiate them, you have some big structures called macroconidia, and then there are some small structures that are referred to as microconidia. Please remember, the microconidia are arranged in a descending order, which means that in Trichophyton you have the maximum microconidia, then a little in Microsporum, and least or absent in Epidermophyton. That is how you learn the microconidia. Okay, first I'll show you a picture. So let's have a look at a picture. The first one that you have, can you see? Can you all see these tiny structures? So when you're dealing with these tiny, so many of them, this is what you're calling as microconidia, right? So how many microconidia are you seeing? I'm seeing abundant microconidia. So which organism this must be? This must be Trichophyton. This must have been Trichophyton. Look at the next organism. In the next one also, I am seeing those tiny structures, but they've reduced. Don't you feel they've become a little lesser in number? They are there, but they are a little lesser in number. So when I talk about microconidia, they are there, but okay number. So what do I call it? I call it the next one, that is Microsporum. And finally, coming to the last one, the background has become clean. I don't see any tiny structures anywhere. So the microconidia have almost become negligible. This is what you call as the last one, that is Epidermophyton. So the first part of this is done. We are done with that. It is going to have max to least, TME, max to least. That was microconidia. What about the macroconidia? I'm going to act a little smart over here, and that is, I have actually made a mnemonic on my own name, and that is how I had learned it, and I will make you also learn it in that manner. What do I mean by that? When I talk about TME, TME is telegram, right? I told you telegram. And my Telegram channel is how I have learnt it. My Telegram channel is Preeti Sharma's channel. Okay, so TMEPSE. Why did I say PSC? Because if they ask you what is the shape of the macroconidia, the first one is going to have a pencil shape, the second one is going to have a spindle shape, and the third one is going to have a club shape. So repeating once again, when I say TME, you are going to learn it as PSC, pencil, spindle, club. Let's go ahead and look at the pictures once again. Now back to, again, as soon as you get a question on it, this is what you're supposed to write. You're going to remember my Telegram channel, and that is TMEPSC. What do I mean by that? So when I say T, we have pencil shaped. Can you see these big structures? Yeah, these big structures are coming across as pencil shaped only. So when I talk about the macroconidia, they are going to be pencil shaped. Let's look at the next one, the next picture. Again, as soon as I get a question, I write TMEPSC. So what do I see over here? The next organism, microsporum, because I'm going to see a spindle shaped structure over here. So remember, microsporum, the macroconidia is going to be spindle shaped. Coming on to the third one. The third one is in front of you. Again, I get a question. I write TMEPSC. So the third one is epidermophyton. So what is the shape that you're going to get of macroconidia? It is all club shaped. So this is the last one, that is club. So repeating once again, like I said, it's a smart mnemonic that I've made on my name and my channel, TMEPSC. So remember, pencil, spindle, and club shaped. Okay, having said that, now moving forward, now I hope this is definitely one of those questions which is going to come a lot in the papers, you will realize. Okay, moving forward, this is another diagrammatic representation putting everything in one place. So you will have trichophyton, microsporum, epidermophyton, that is you have T, M and E. Can you see the shapes written in front of it? Pencil, spindle, club. So means they have written P, S and C, exactly how we had studied it. It's written in all the textbooks like that. Okay, all said and done. Now I'm going to tell you a particular test which is very important, if you're targeting a little extra marks out there. And that is particularly done for hair. This is a hair perforation test. So what the sample that you're going to take from the patient is obviously going to be the hair, and you're going to incubate it with the fungus. Now, firstly, why do I want to do this test? Whenever I want to differentiate between two trichophytons, one is trichophyton rubrum and one is trichophyton mentagrophytes. So out of trichophyton rubrum and mentagrophytes, I took the hair and I incubated it with the fungus. So what will I see in case of rubrum and what will I see in case of mentagrophytes? So remember, in one of them I saw that the hair remained intact. What it was 2 weeks before, it is 2 weeks later, it's intact. In the next one, I saw that there were some perforations in the hair that were forming. There were some wedge-shaped perforations that were coming up in the hair. So when there is no perforation, means hair perforation test is negative. When there is perforation, this means hair perforation test is positive. So remember, rubrum gives you a negative test and mentagrophyte gives you a positive test. How do I learn that? So I've learned it in the form of a Hindi mnemonic actually. I hope all of you will be able to correlate with me on that. So remember, when I'm talking about mentagrophyte, phyte is farna. Farna means perforate, right? So phyte is going to perforate, or phyte farega. So phyte is farna. This means the perforation test is going to come positive in which one? In mentagrophytes. So remember, the men are going to fight and faro. So men fight a lot and then they tear each other apart. That is exactly how I've learned it. So mentagrophytes are going to show you the perforation test positive. There's another test which is going to give you that extra edge, and that is known as the ID reaction. When you go into the previous year papers, you're going to analyze this. That is known as the ID reaction. And what do you have in ID reaction? So this can usually, in most of the cases, this is seen because of fungal therapy, antifungal therapy. So you started giving some antifungal therapy to the patient as a part of his treatment, or because of whatever fungus he has. This was his first lesion. This was his primary lesion. But because of these the fungus is releasing some products, or you started giving antifungal therapy, so the fungus broke and it started giving products. As a result, there were some satellite lesions which were formed away from the original lesions. That is known as the dermatophytids. When I say phytids, ID says that this is also known as ID reaction. So what is dermatophytids or what is ID reaction? Remember, it is nothing but that you are giving some antifungal therapy, or because of some fungal products from the main lesion, small chota lesions are forming around it, dermatophytids or ID reaction. Okay, moving on. Now we obviously have to discuss the treatment part of it also. The treatment of tinea, I think everyone knows that we have to give azole topical. I think tinea is something which you might have seen around you also very commonly. Maybe your relatives, your friends, or you yourself have suffered from some fungal infection. So remember, first you have to have a combination. One is going to be a topical antifungal azole derivative. Second, you can have an oral drug also. Oral itraconazole or terbinafine is given. Terbinafine is these days being preferred. At least a minimum of 14 days course has to be given. Then it can go on to 2 to 3 months also, depending on the patient's condition. But terbinafine is better accepted in patients, so that is what is being given nowadays. But particularly for tinea capitis, patients who come to us with tinea capitis following seborrhea, following probably dandruff, that's the usual history that we get. Following dandruff or seborrhea, there's a case of tinea capitis that has occurred. So in those cases, oral griseofulvin is what is the drug of choice that is being said. But yeah, in most of the cases, the usual therapy which you should be knowing, because you'll be prescribing it to a lot of people, is you have to give some topical antifungals which are azole creams, and along with that either an oral itraconazole or what is preferred is an oral terbinafine. Okay, having said that, this is going to wrap up all of your superficial mycosis. Having discussed the superficial mycosis, let's go ahead and start our discussion with the subcutaneous mycosis. I hope all of you remember the mnemonic. Subcutaneous mycosis had MRCS. That is, let's do a quick recap. The first thing is going to be mycetoma. The next one is going to be rhinosporidiosis. The third one is going to be chromoblastomycosis, and the last one is going to be sporotrichosis. Now just a word over here. If you guys remember, sporotrichosis or Sporothrix schenki is coming in two places. It's coming in your subcutaneous mycosis also, and it's also coming in your dimorphic fungus, right? So I'll be teaching it to you all together in the dimorphic fungus. So primarily over here, I'm going to focus on the first three, and let's begin with the first one, and that is mycetoma. Now I hope as soon as I say mycetoma, there's a very famous image that should be coming to your mind. That is the very famous Madura foot, or there's going to be a foot that will be given to you in the paper. Along with that, there will be multiple discharging sinuses. Multiple discharging sinuses. So we have got a schematic diagrammatic representation where you can see there's some yellow or brown pus kind of a material that is coming out. Basically, there's something to do with the discharge that is coming out. Well, having said that, the causes of this can be of two types. This same mycetoma or the foot that I showed you, it can either be because of something known as actinomycetoma, or it can be because of eumycetoma. And now I want all of you to learn basic alphabets. That is, when I'm talking about actinomycetoma, that is A followed by B. So that is because of a bacteria. There is a gram-positive bacteria which is responsible for it. Whereas when I say eumycetoma, after E comes F. So this is because of fungus. That is how we are going to learn it. So simple. After A comes B. So actinomycetoma is the bacterial cause of it. After E comes F. So fungus is going to be the cause of this. Now what organisms? Let's talk about that as well. When we are talking about examples, it's very simple to learn that actinomyces. When we say actino, the actino should have some word called actino in it. So actino, madura, madure will obviously be an actinomyces type. Other than that, there's a red color granule. Means what? Didn't I just show you that there are going to be discharging sinuses, and there are a lot of sinus pus kind of a material that comes out. So what is the color of the granules? The color of the granules that are coming out, that can also sometimes help me and give me a hint in identifying which organism am I dealing with. So please remember that when I'm talking or when I see red color granules, that is going to be Actinomadura peletriae. So remember, actino will tell me it's to do with actinomyces, and peletriae I'll give you a mnemonic in a while. Other than that, there are other bacteria which are going to be Nocardia, Streptomyces, Actinomadura. They can give you something like a yellowish discharge or a granule which is yellowish. So now what is now again going into a little bit of a mnemonic. I hope everyone knows yellow in Hindi is known as peela. Yellow is peela, right? So now but the irony of the story in microbiology is that whatever is seen is not what actually is there, right? So now peela is not peela. So when you are saying peletriae, When you're saying pelletory, it sounds like pila, but this is the one which is not pila, because that is how microbiology is. It's going to be a little tough. It's going to be a little different, opposite of what it actually should be. So pila is not pila. So pelletory actually is going to give you red color granules, and all the other bacteria that I've written, nocardia, streptomyces, all those are going to give me the pila, the yellow color granules. Now coming to the fungus part of it. When I talk about the fungus, obviously one of the most famous fungal organisms that we have is Madurella mycetomatus. That is why it is very famously known as the Madura foot also. It is very famously known as the Madura foot also. Please remember, again, we can have some brown color granules, we can have some white color granules. You don't have to go into so much of detail, but yes, for example, Madurella exophylla. Exophylla is going to have brown color granules. Acremonium and Boydii, these are going to have white color granules. So yes, a little bit I think I have taught you when we were doing the initial part. Do you remember when we were studying about the starting, when I told you there are septate hyphae, some septate hyphae are going to be phioid or containing melanin, and that time I told you all the R things are going to have melanin. So Madurella is going to have melanin. Similarly, I had told you there is something called hyaline. Hyaline is not going to have any color. So anything with the Y sound as a U sound is going to come under it, like acremonium or Boydii. So all these Y and UU ones are hyaline, which means it doesn't have a color, it's white. Whereas all the ones which are showing me melanin, all the AA ones. So if you remember, Madurella was one of them. So yes, exactly, it's not known, but again, like I said, if you know your starting and your basic of fungal chapter well, half your story or half your battle is won. Finally, if I ask you about the treatment, it's common sense, guys. When I'm talking about the treatment of actinomycetoma, as I told you, it's a bacteria. So when I'm talking about a bacteria, I'll be giving antibiotics. That's the best treatment. So what antibiotics am I going to be giving? There's a cotrimoxazole with or without amikacin. So cotrimoxazole is something you will find written as a drug of choice everywhere, but some of the authors and clinicians believe that amikacin should be clubbed with it, and that is going to go on for quite a long time of at least 6 months. Whereas when I'm talking about eumycetoma, now eumycetoma is simply a fungus. For fungus, I can't give antibiotics. So surgical amputation or surgery is what is going to be advised when there is a Madura foot, or surgical resection is what is needed, right? So remember, for bacteria it's antibiotic, and for fungal it is resection. Well, with that, if I show you the gross picture, which I already have, it is the classical Madura foot with discharging sinuses. If I look at it under the microscope now, this is the first picture that I want to show you. So I saw that whatever pus, so I'll see, look at this patient once again, whatever pus you will get, whatever discharge you are going to get, you are going to collect it and look at it under the microscope. When I looked at it under the microscope, this is what I saw. What we notice in this slide is the very, very classical sun ray appearance. So let me zoom into it for you to be able to see the sun out here. As you will visualize, there are some purple color organisms which are radiating out. So as I told you guys, now when I say purple, if I say purple and I say this is something, although this is not a gram stain, this is actually an HNE picture that you have. But when we talk about gram stain, anything purple means gram positive. And what is going sun ray? This is the very famous actinomycetes. This is the very, very famous actinomycetes, which is a gram positive filamentous organism. I hope you all remember from your basics that you have studied. So gram positive filamentous organism, that is going to be actinomyces. And do you also notice, if I draw it once again, yes, you can see this classical sun ray appearance that is going on, but alongside, if you see the surrounding of it, you will see there is a pinkish color layer. See, all around there's a pink color layer surrounding it, here as well as here, right? So remember, this pink color layer is defined as the very famous Splendor-Hopley phenomenon. This is referred to as the Splendor-Hopley phenomenon. And please remember over here that there are a lot of theories given behind what is Splendor-Hopley phenomenon, but I'll tell you the one that is most accepted, and that is the antigen antibody reaction. So please remember that we consider that actinomyces is an antigen, just like any other bacteria, virus, fungus. Every organism has an antigen, and if every organism has an antigen, you will make an antibody against it. So basically, it's the combination of this antigen and antibody that is happening over here. In other words, this pinkish layer is nothing but the famous antigen antibody reaction. Okay, so now before I go on to the other picture, remember the Splendor-Hopley phenomenon is going to be coming twice when we talk about this fungus chapter. So Splendor-Hopley phenomenon, number one, is going to be seen in actinomyces, and second, it is also seen with an organism called Sporothrix schenki. I'll be teaching you Sporothrix schenki in a while, and that is exactly where you'll see this phenomenon once again. Okay, this was if it was a case of a bacteria. So imagine this is your mycetoma, this is your foot, you had a discharge, you picked up the discharge, you saw it under the microscope, it started looking like a bacteria. So your treatment goes in terms of a bacteria like antibiotics. On the other hand, you had the same picture over here once again, and now when you look at it under the microscope, you see something like this. You see there is some organism and you can see a lot of brown color material. Now with the brown color material, what is coming to your mind? Brown color means something to do with melanin and everything with A. So this could be a case of Madurella exophylla. So that Madurella, which was having the melanin, this could be one of the fungal etiologies. And yes, if it's fungal, then obviously surgery is going to be something over antibiotics that I'll prefer. Having said that, coming back to the mnemonic, that is MRCS, this was the end of mycetoma. What other things are we going to study after that? R stands for rhinosporidiosis. Now, some of the authors believe that this should be studied here. Some believe that it should not be studied over here. Why? Because when I'm talking about rhinosporidiosis, the organism is Rhinosporidium seaberry. So now there is an update. They say that Rhinosporidium seaberry, sea should remind you of something like the ocean and the sea and the water. So they say that rather than calling it a fungus, you should classify it as an aquatic parasite or a protozoa. It should be classified as an aquatic protozoa. So please remember, because of the sea, you are going to put it up under aquatic. You're going to put it up under water. So many people don't even deal with it in the fungal chapter. But for a very long time, this was considered as a fungus, and that is the reason that I'm also going to teach you over here. But yeah, if they ask you the latest classification, you should know it's now considered as an aquatic parasite. All said and done. Now, as soon as I hear the word rhino, it's going to, remind me something to do with the nose. So what are the most common sites where you're going to see the infection? It's going to be the nasal cavity. But again, I'll show you a picture. There's a very classical photo for rhinosporidiosis that you have to see. Can you see this classical strawberry polyp that is coming out of the nasal cavity? That is how you define it. So as soon as they mention strawberry polyp, especially strawberry nasal polyp, the nasal word should remind you of rhino. So coming all the way back, one is nasal cavity, which is obviously going to be the most common, and I've told you the gross finding of it, it is going to look like a strawberry polyp. On the other hand, there are some rare sites. This can also occur in the genitals. This can also occur in the eyes. So please don't be misled if ever you see something like a genital or an eye history, but the picture is very classical. Don't feel it's not the nose, so it can't be rhino. Rhino can occur elsewhere also, right? Talking about the next, that is microscopic examination. Again, something that you can see over here. Can you see these big structures, which are the sporangia? And then you can see there are tiny structures inside it, which are known as the endospores. I can see the endospores which are sitting inside it, and exactly what I am going to visualize. So there'll be big sporangia, and inside you will have the spores. So here you have spores or endospores which are put up inside it. Next, you'll ask me the culture media, and that is where the trick in the story comes. This is non-cultivable, which is a question that has come so many times in the previous year papers. This is a non-cultivable organism. In fact, let me tell you, in the entire mycology, there will be two organisms that I will tell you which are non-cultivable. One of them is put up in front of you, that is rhinosporidiosis, and the other one is going to be Pneumocystis jirovecii or Pneumocystis carinii. So yes, Pneumocystis carinii also will have the same answer, that it cannot be grown on any culture media. Next, what is the treatment? If there's a polyp, like I told you in the beginning, that there's a strawberry nasal polyp, so you'll have to remove the polyp. So the ideal treatment is going to be a polypectomy. The best one that you're going to do is going to be a polypectomy. So that's your final flashcard that you have for rhinosporidiosis. Rhino should remind you that nose is the most common. Rhinosporidiosis is Rhinosporidium seaberry. So C should remind you that nowadays they are putting it under something to do with sea, that is aquatic protozoa. cannot be cultivated. Very, very important PYQ that you have. Apart from that, you can see the strawberry appearance, you can see the spores, sporangiospores, so that is very classical. Moving on to, remember MR, mycetoma done, rhinosporidiosis done. The last one that we have is C. So C stands for what? Chromoblastomycosis. Now let me first tell you the image and then I'll come down to the theory aspect. When I talk about chromoblastomycosis, there's another name given to chromoblastomycosis, and that is verrucous dermatitis. Chromoblastomycosis is referred to as verrucous dermatitis. And what do I have to know about it? Dermatitis tells me that there is going to be a skin involvement. I can see a foot picture that has been given. So please remember, this is because of traumatic inoculation. So you will ask me that why is the patient having this kind of trauma? So these are usually forest workers. And you know, why is the emphasis so much on forest workers? What is so different about forest workers than all of us? Because they tend to walk barefoot. So you will have the history of a forest worker. Most common question that comes, there's a forest worker who's walking barefoot, and because he's walking barefoot, there's a traumatic inoculation of the organism that has occurred. So I've understood why skin, because he's walking barefoot. But why verrucous? What do you understand by verrucous? Verrucous, verruca, what is that in dermatology? Verrucous refers to wart, right? So please remember, you see a warty cauliflower-like growth. You see a warty cauliflower-like growth which is right in front of you. You can see this warty cauliflower-like growth put up here. That is the reason you call it verrucous. So verrucous is also sorted, dermatitis is also sorted. What is the other name? Chromoblastomycosis. So yes, what is this chromo? Chromo means something to do with color, right? And I can see the color in front of me. What is the form that you're seeing over here under the microscope? We see the very famous copper penny bodies. The copper word is telling me that yes, there's a brownish color. That is why I called it chromo. So there is something called copper penny bodies, but I don't think the examiner is going to be that easy with you that he'll show you a copper color body and say that is this a copper penny body. He will tell you some other names. The other names are said to be sclerotic body. That's the next one that you have to know. Apart from that, we have something called the medullary body or the muriform body. So sclerotic body, medullary body, and muriform body, these are the ones that you need to know over here. And obviously copper is the only name which is looking sensible because it looks copper in color, but examiner is going to ask you the other names. So now most of it is done. Now let's come to the theory part of it, that okay, chromoblastomycosis was the name of the disease, right? But what is the name of the organism? So all the FFFs, because it's a forest worker, that is how I have learned it, because it's going to be something to do with the forest worker, then all the Pho and F related things are the organisms that are going to come. So Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. Can you see the abundance of the F forest worker coming across? That is how you learn. So chromoblastomycosis, which you see in the very famous forest workers, are going to be called, this was a recent question also that came in the paper. It is Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. These are the FFF organisms. Root, I think I have already taught you, and you all know that how from a forest worker there's a traumatic barefoot history that will be always given to me. Apart from that, how are you going to do the treatment? Again, we have something known as amphotericin B, and we have 5-fluorocytosine. Forest and Fs are not going anywhere. So amphotericin B, 5 again an F, fluorocytosine again an F. Recently, they have also saying that only drugs alone cannot help. Firstly, they've introduced a new drug that is voriconazole. Voriconazole is another very important question that comes somewhere else in aspergillus that I will be teaching you in a while. But yeah, voriconazole is being treated or used for most of the disseminated and the severe infections. Apart from that, they are saying only medicine will not help, because at the end of the day, it's a very bulky cauliflower-like lesion, right? So you'll have to go in for maybe a surgery or a laser, or nowadays even cryotherapy is being tried. So basically some adjuvant therapy will be needed in order to decrease the bulk of this size also. Medicine alone may not be very useful here. Okay, talking about the last one, under the subcutaneous, I hope you remember you had MRCS, so mycetoma done, rhinosporidiosis done, chromoblastomycosis done. We are left with sporotrichosis, and like I told you, sporotrichosis is something that we will be dealing under the dimorphic fungus, because that is a separate and the next topic which is very, very important, right? So that primarily finishes off MRCS, which means that you are done with this, and now you're ready for your summary. So when you are ready for your summary, this is what you have in front of you, and this is the summary of everything, starting from the superficial as well as the the subcutaneous, both of them together. So let's start with the summary tables, guys. Remember, these were a set of tinea that you studied. So the first one is what? You can see something on the cap, so that is going to be what? Tinea capitis. But if that starts showing you flakes, if it starts showing you flakes and crust, that is known as tinea favus, and favus is something that was showing you crust, so you also called it scutula. If it becomes a boggy swelling, then we had started calling it carrion. I hope you are quickly revising this with me. We've done all of this. Next, when you're talking about the trunk, when we are dealing with the trunk, obviously we have tinea corporis for the trunk is what we were using. But if you zoom in and if you see the next lesion is becoming all concentric. As soon as I start using the word concentric, the disease that comes to my mind is going to be tinea imbric, that is imbricata comes to our mind. Next one, as soon as I see the nail involvement is going to be tinea unguum. So that is something that is important. Unguum, ungual means nail. Okay, these teneas are done. What next? I have some pictures of the microscope which are going to help me. So the next one, remember these three dermatophytes, and remember the selfish mnemonic that I told you, that we were talking about TME, that is trichophyton, microsporum and epidermophyton. And what were we having? We were having P, S and C. What was P, S and C? P was what? We had the pencil-shaped macroconidia. Next, we have the spindle-shaped macroconidia. And lastly, we had the club-shaped macroconidia. That was the story of the macro. What is the story of the micro that you have to know? What was that going? That was going in the descending order, right? I hope everyone remembers this. We've discussed it in a lot of detail. Coming to the next one, you can see the foot. As soon as a foot is given to you, you are either going to think of actino, or you are going to think of the fungus, that is Eumycetoma. But what is the picture given? If I ask you, what is the picture given over here? The sun ray appearance. The sun ray appearance was something that you saw for actinomyces, right? Next, coming to the classical nasal. As soon as I see nasal involvement, the rhino word comes to my mind. So this is a classical case of rhinosporidiosis. The rhinosporidiosis, the most famous question, can it be cultivated? No, there is no culture possible for this. Coming to the last one, I can see a foot, a forest worker, foot, all the FF, Fonsacia, forest worker, foot, amphotericin, all the FFF things coming, and the very famous copper penny bodies. So as soon as I see the copper penny bodies, I am talking about chromoblastomycosis. Chromoblastomycosis comes to our mind, and that is what sums up everything that you have studied in the superficial and the subcutaneous mycosis, with which you are ready for practicing a few questions. Let's begin. So first and foremost, you have a 28-year-old man who's presented with recent onset of rash that involved his upper arms. The patient was otherwise healthy with no known allergies, medications, or chemical exposure. The physical examination revealed multiple hypopigmented, slightly scaly lesions on both arms. The culture was isolated, but the microbiologist could not get any results on a regular SDA media. There were no results on regular SDA media. Which of the following fungus is difficult to isolate on a regular SDA media? So I hope you remember that everything is a fungus over here, and everything should be able to be, should be recognized on SDA. But when I'm talking about number one, hypopigmented lesions, the thing that was coming to my mind was Malassezia furfur. And if you guys remember, Malassezia furfur cannot be grown on a regular SDA because it had to show you the very, very famous fried egg. Remember, it had to show you that fried egg appearance. So for fried egg, you need olive oil. For frying the eggs, you will be needing olive oil. So SDA with olive oil is what you need. Why? Because Malassezia furfur was a lipophilic organism. I hope you were able to solve this question. One clinical hint given over here was hypopigmented. Coming on to the next question. Here you have another type of the same one. Here you have a young male, a 30-year-old male who's come to you with hypopigmented macules on the upper back. On examination of the skin scrapings with 10% KOH under the microscope, spaghetti and meatball appearance was seen. Now, as soon as I see the spaghetti and meatball appearance, I know I'm dealing with tinea versicolor, or in other words, I am dealing with Malassezia fur. That is what is very, very important that you have to know. Okay, let's move on to another question. Let's go on to a very short question, but something that has come in the previous year papers too many times. What is the boggy swelling on the scalp? And actually, this is a dermat question. Boggy swelling. So, tinea capitis, carrion, cruris, or Barbie. So, let's talk about Barbie is something that is going to involve the beard, right? Cruris is something that stands for the groin. Capitis means cap, that is on the scalp, but it's not boggy. When they ask me which is the boggy swelling is going to be again on the scalp only, but the boggy swelling on the scalp is the carrion. Having said that, moving on to the next question. Which of the following infects the hair, skin and the nails? So the trio is affected. When the trio is affected, it is, remember, many students will do this mistake. They've learned trio is something tri, but what tri? Tri was trichophyton. So when I talk about dermatophytes, it is trichophyton. It is not sporum. Where do you study trichosporum? Do you remember there was something called trichosporin bijli? Bijli is how you had learnt it, and I told you bijli is white, so this was causing that whitish thing, white piedra in the hair. So that was trichosporin bijli. Okay, over here the TME that you talk about, that is trichophyton, that infects all the hair, skin and nails. Let's practice one more question. I've got more questions because this is a very important topic. Moving on to the next question. I've got you a couple of extra questions out here because this is definitely one of the important topics that we have. Let's go and discuss this. All are true regarding dermatophytes except. All are true regarding dermatophytes except. So basically it's a true-false question. Let's start solving it. Are they differentiated on the basis of macroconidia? Of course, we had a very famous mnemonic. There is TME, PSC. So they are differentiated on the basis of the macroconidia. Does epidermophyton infect skin and nails? Skin, of course, and epidermophyton ended with N. So does it affect the nails? Yes. Microsporum has fusiform macroconidia. So I had told you TME, PSC. So trichophyton had pencil shaped. Microsporum had spindle. Spindle and fusiform means the same. So that is also true. Next, last one. Epidermophyton has abundant microconidia. See, when you're talking about microconidia, you had to basically go in a descending order. That trichophyton had maximum, then microsporum, and then epidermophyton. So epidermophyton doesn't have abundant microconidia. Epidermophyton has the least microconidia. So the wrong statement over here was option 4. You had to select that. Coming on to the next question. Which of the following is used for the cultivation of Rhinosporidium? I hope you remember I told you again and again, when I'm talking about Rhinosporidium, it cannot be cultivated. None of the above is going to be the answer. It is not cultivated. And please remember, what are the others written? SDA. SDA is for any fungus. I hope you all know by now. That is the chapter that we are reading. What is HeLa and Hep2? If you've heard the virology lectures, HeLa and Hep2 are cell lines. HeLa and Hep2 are cell lines which are used for growing the different viruses. But for Rhinosporidium, I don't need either because it cannot be grown at all. Coming on to the next question that we have. Here there is a 24-year-old South Indian patient with a history of taking bath in ponds and has presented with unrelated nasal polyps. The patient was admitted and a polyp biopsy was taken which showed spherules with endospores. I think everything is coming into place. All of the following are true about the diagnosis of the given patient except. So it's again a true and false question. Is the treatment removal of the polyp? Yes. Do you see spherules on biopsy? They've already mentioned spherules and endospores are seen. So that is correct. Is it a strawberry, a reddish colored, bleeding to touch polyp? Of course. Can it be cultured on Sabaurout's dextrozagar? All throughout, if I'm talking about this disease, I'm talking about rhinosporidiosis. Can rhinosporidiosis be cultured on any of the culture media? No. So what is the answer? Can it be cultured on Sabaurout's? No. So this was the wrong statement, or you can say the correct answer in this case. Moving on to the last question that we have in this category. There is an H&E stain of a nodular lesion of the arm of a forest worker that is shown in the figure. Which of the following is the key diagnosis? So when you see, firstly, you see a forest worker. Secondly, you are going to see that, yeah, there is a brown color body, and immediately what comes to your mind is a copper penny body. As soon as I say copper, the color is coming, and your answer is in front of you. That is chromoblastomycosis. Actually, this is not the last question. It's pretty interesting. I've tried to include a bulk of questions so that, you know, most of them you can solve alongside me. So actually, let's practice one more question. Let's take this up as well. A patient presented with a swelling in his right foot with multiple discharging sinuses. Obviously, mycetoma has started ringing in your mind. The lesion did not respond to antibiotics. So I know that when I'm talking about a mycetoma, either they will be giving me a history related to a bacteria. If it would have been a bacteria, it would have responded to antibiotics. Here it did not. This means the cause is the other one, that is the fungus. So now if they ask me what is the likely agent, I have to pick up the fungus over here. Actinomadura is a bacteria. Nocardia is a bacteria. Sporothrix and Madurella mycetoma are fungus. But which of them is famous for causing mycetoma out of these is obviously going to be the Madurella mycetoma. So that is the answer that I will pick up over here. With that, we wrap up the superficial and the subcutaneous infections. And now what we move on to next is the deep or the systemic ones. So the first one that we will be covering under that is going to be the dimorphic fungus. Starting with the next topic, and that is going to be the dimorphic fungus. I hope all of you remember the basics about a dimorphic fungus, so we are going to quickly revise that first, okay? When I talk about dimorphic, means it's going to exist in two morphologies, and I hope you remember the two morphologies were number one, the yeast form, and the number two was the mold or the hyphae form, right? And now I also want you to tell me the temperatures with the mnemonic that I taught you, that the yeast form is something that you will be seeing in a heat. Yeast and heat are rhyming. Mold and cold is rhyming, right? So mold form you will be seeing in cold. Having said that, so the yeast form is something you will see at a higher temperature of 37 degrees, and mold is going to be something that you will see at a slightly lower, colder temperature, that is 25 degrees. And what are the organisms that come into it? I hope you remember the very famous mnemonic. Because you talk so much about heat and cold over here, body heat probably changes shape, and time and again I am going to come back to this mnemonic. What is it about B? So let's start right away. Rather than writing everything again, we are going to start one by one. So the first one is going to be blastomyces. So blastomyces or blastomycosis, that is going to be the B, and let me show you the classical photo. You see it once, you're never going to forget it. So remember, blastomyces, when I say blastomyces or blastomycosis, it is caused by the same organism, that is Blastomyces dermatitidis. That is the name of the organism. Second, what you have to know over here is it is also known as North American blastomycosis or Chicago and Gilchrist disease. See, if I'm saying something is a North American blastomycosis, there is going to be a South American blastomycosis, and because you're so obsessed with America out here, after that you're going to have a European blastomycosis also. So life is going to become quite complicated. But let's go one by one and solve the complications. So for the time being, the first, if they just mention simple blastomycosis, north obviously comes before south. So north comes above south. So north is the first thing you'll think of. If simple plain blastomycosis is mentioned, and with America, you'll think of Chicago and Gilchrist disease. Having said that, the way you write B, now that is going to change the entire game, because B will tell you that, yeah, it shows you B for budding, but what kind of budding does it show you? It shows you a broad-based budding. It's going to show you a broad-based budding, and that basically means that if, can you see this organism and this picture here? Firstly, tell me, it's looking very, very black. The outlines are looking very black. So if I'm dealing with the black color stain, that stain must have been the Gomori methenamine silver stain used over here, right? Silver is going to give it a black color. Now tell me the next thing, that if I'm seeing a broad base, means if this is the fungus, I'm not seeing a tiny little bud, a tiny tip. No, I'm seeing a broad base. Look at the base. The base is very broad. So that is what you analyze by broad-based budding. Secondly, with the B, you're going to convert it. See, B looks something like an 8. So with the B, you're going to take it into 8, because is this giving you the very classical figure of 8 appearance? That is one very classical catch point about blastomyces. It shows you a figure of 8 appearance, and remember the size is also going to be a minimum of 8 to 15 microns. So even if you don't want to learn everything, at least learn 8. The shape is also figure of 8 and the size is also going to be 8 microns, and B for broad base, B for blastomyces. So everything about blastomyces is B, 8, 8, and that's the way of memorizing it. We'll quickly do the treatment also. Treatment of most of them is going to be the same. You ultimately have to come down to the azoles. So for mild disease, you have fluconazole, you have itraconazole. So for mild diseases, in all of them, whether blastomyces or the coming dimorphic fungal organisms, it's going to be the azoles. But only if it is a severe or a disseminated spread all over the body, then before you give these azoles, you also have to give a therapy of amphotericin B. So simple. If it's a mild disease, azoles. If it's a severe disseminated disease, give a drug of amphotericin B, a cycle of that, and follow it up with the azoles. Okay, this was blastomyces. So as I told you, the B1 is sorted for you. What is the next? Body heat. So the H over here is now going to be histoplasmosis. This is going to be histoplasma or histoplasmosis. So let's come down to that. There's a way of learning it, which I'll tell you. But when I say histoplasmosis, what organism is coming to your mind? So that organism is Histoplasma capsulatum. You can see many of them. There's something called Histoplasma capsulatum or Histoplasma capsulatum duboisi, and that is only on the basis of whether it is seen in America or Africa. So remember, capsulatum is the more common one, which you see everything over here is very American predominant. Dimorphic fungi are very, very common in America, most of them, right? And in America, there is a place called Ohio. I'll be coming to that. Anyway, so Histoplasma capsulatum in America, and duboisi is going to be something to do with Africa. Now, please remember there's a very famous previous year question regarding the reservoir of histoplasmosis, and this is very commonly seen in the bird or the bat dropping. So, you know, how does it actually come to us? It comes to us by the mechanism of inhalation from these bird or bat droppings, and that is why bats, where will you find bats? Bats you will be finding in the caves. So, one of the other names for histoplasmosis is the caves disease. So, let us do all these names because you have so much of geography and you have so much of bird and bat things. So what are all the names that are given to histoplasma? So how have I learnt it? Firstly, because when you say histoplasmosis, high. So high is going to be a place called Ohio and Darling's disease. So I have learnt it as high Darling. I have learnt it as high Darling. So remember, when you're talking about histoplasmosis, high Darling should come to your mind. High will remind you of Ohio and Darling is going to be the other name. Other than that, I told you it is to do with bird and the bat droppings. So yeah, this is something commonly seen in caves. And now let me tell you the last but the most frequently asked name. It is known as reticuloendotheliosis. What is the meaning of that? Firstly, tell me, what is a reticuloendothelial cell? You might feel that this is a very, very fancy and reticuloendothelial system might be something altogether new that ma'am is going to introduce to us. But no, it's nothing but macrophages. So where are macrophages present? All over the body, but very common in organs like liver and spleen. So if they want to ask you where is histoplasma going to go and sit, it is going to go and sit in macrophages. But they didn't want to say anything so simply. So instead of calling it macrophages, they said it's going to go and sit in the reticuloendothelial system. But a very famous previous year question. Now, it's a dimorphic fungus, means I have a yeast form and I have a mold form. Let's look at both of these. We'll zoom into this picture first because this picture is the one that we have is the yeast form. And where is the yeast form going to be present? Inside which cell? Everything is going to be inside a macrophage. So let's zoom into this picture. This big cell that you see out here, this is actually the reticuloendothelial cell, or in simple words, it's a macrophage. Why is it a macrophage? I can see that blue color nucleus also over here. And where is the histoplasma then? Histoplasma is the yeast form. So can you see the tiny, tiny dots? The tiny, tiny dots over here, those are going to be the histoplasma. Remember, that's going to be the histoplasma. That is the yeast form. So yeast ho gaya. Now, where is it present? It's usually inside. It can be outside the macrophage also. Now coming to the next, and that is going to be what? Stain. Why is this blue in color? What stain have we used? We have used lactophenol cotton blue. Can you put lactophenol cotton blue directly onto the sample? No. Remember, before before putting lactophenol cotton blue, you had to do an SDA agar growth also. So on SDA agar, we can get suede colonies. What is suede colonies? They can be of many colors. They can be white, they can be brown. Suede, it's a cloth. I hope everyone has seen. It's a very thick cloth, a thick and a smooth cloth. That is suede. So suede colonies are seen. And on top of that suede colonies, when I do lactophenol cotton blue, this is the picture that I'll see. Let me zoom into this picture. So this is the lactophenol cotton blue, and if I look very carefully, I can visualize that, yeah, there are some projections coming out. So if I draw it, it looks something like this, and I have some projections coming out. This is a very famous previous year question. And these projections are known as tuberculate macroconidia. These are said to be tuberculate macroconidia. So how am I going to learn all of this? And now I'll tell you the trick. The first thing about histoplasma that I told you was high Darling. So that will remind you that, yeah, it is high for Ohio, Darling for Darling disease related to bird and bat, so known as cave disease, going to happen in the macrophages, so known as reticuloendotheliosis. Now I'm going to tell you that histoplasma is the long lost brother of TB. That's just a way of learning that I have gathered, that this is a very good way by which I can learn. We realized, see, TB is what? TB is a bacteria. Histoplasma is what? Histoplasma is obviously a fungus. So they are somewhere long lost brothers. They are lost in some mela over here, because whatever TB is showing, I'm seeing that histoplasma is also showing. It's like a twin brother. Okay, so now what all does TB show? You tell me. There's nothing to write. Everyone knows the symptoms of TB. There is going to be cough, there's going to be sputum, there is chest pain, there is blood in the sputum, hemoptysis, fever, night sweats. Do I need to write all of that? Of course not. Living in our country, you know, not knowing TB is not possible only. Whatever features you knew about TB, the same clinical features are shown with histoplasmosis also. So the clinical features of both of them are the same. Next, what is the very famous necrosis that you see in TB? TB shows you the caseous necrosis. So if TB will show you caseous necrosis, histoplasma will also show you the caseous necrosis. So they're coming across as twin brothers. And lastly, histoplasma decided that my name should have TB in it. So which kind of macroconidia did it show you? It decided to name its macroconidia after its twin brother, that is tuberculate. So remember, I have learned histoplasma is the TB wala fungus, TB jaisa fungus. It is the fungus which looks just like TB. Okay, having said that, so now coming all the way back, we were doing body heat. Now let's come to P for what? So P for actually P is for two things. First, I'll start with the P, that is Penicillium marnifi. Now, remember, I'm going to tell you a very interesting story for that also, but Penicillium marnifi, the name has changed and it is now referred to as something known as Talaromyces marnifi. So that is something you should be knowing. But either ways, whether they write Penicillium marnifi or Talaromyces marnifi, my mnemonic I have made out of marnifi, so that no matter what they write before that, my mnemonic is clear, it is marnifi. So what is marnifi? So when I say marnifi, it sounds like marna. You're going to hit someone. Okay, so whom are you going to hit? You're not going to hit any human being. You are going to hit a rat. Basically, you want to marna, you want a rat to move out of your house. How do you chase a rat? Either you have those rat traps, or otherwise you will say that we go around with a broom or a brush. So I will have something to do with a broom, because I'll have to hit the rat and I'll have to make him move out of my house. So when I will hit the rat, obviously the rat is going to turn red. So in Hindi, like they commonly say, that you hit someone so much ke wo lal ho gaya, that is red. Someone turns red, you're hitting that person so much. So marna means hitting. Whom are you trying to hit and make it run away? That is the rat. How, till when are you going to hit it? Till it becomes red. And with what are you going to hit it? Is the broom, because now I will tell you the entire story of Penicillium marnifi. If they ask you what is the natural reservoir, the natural reservoir is the bamboo rat. The natural reservoir is the bamboo rat. So first question is done. That is why I told you what is it about rats that you have in front of you. Question number 2. What is the pigment that it is going to show you? Can you see there is a red color pigment that I have in front of us? Yes, this is a red color pigment and it is trying to diffuse out. It is also trying to diffuse out to some extent. So there is a red color pigment formed. So the rat story I have understood because the reservoir is the bamboo rat. The red story I have understood because the pigment is red. But where is that jhadu or broom coming from? So when I did this very famous, from the culture, I picked up lactophenol cotton blue testing. Can you all visualize that these conidia, conidia, these small conidia, how they are arranged in the form of a brush. So please remember, there is a brush or a broom conidia morphology that you see. There is a brush or a broom arrangement of conidia that you are going to visualize. I hope that is okay with everyone. Repeating once again. Now all your mnemonics will come into place. Whether you call it penicillium or you call it Talaromyces, I don't care much, because my mnemonic is going to come from Marnifi. Marna. So Marna is Marnifi. So how are you going to hit this? But whom are you hitting? I'm trying to hit the rats. What is the natural reservoir? It's the rat. How are you trying to hit? Till the time it becomes red. So red is the pigment. And with what are you hitting? I'm hitting with a broom or a brush. So that is the appearance that I get. So after this P, that is Penicillium marnifi, the next one that we go back to is the other P. So I'll take the P and the C together. Now we are going to have something called paracoccidioidomycosis, and this next C is going to be just coccidioidomycosis. So remember, one is paracoccidio, one is just coccidio. Let's start discussing it. So what do we have under paracoccidioidomycosis? This is caused by Paracoccidioides brasiliensis. Brazil means now I am dealing with South American blastomycosis. Simple way to learn if you're good at geography. If you're not, now the confusion has started, because one side you had something called North American blastomycosis, and now on one side you are having something called South American blastomycosis. So when I told you that north comes above south, right? If you go by just basic, things, north comes above, south comes below. So North American blastomycosis was just blastomycosis, whereas South American blastomycosis is paracoccidioidomycosis. So it's common sense. North comes before or above, South comes below. This means B comes above and P comes below. So if only North is mentioned, I take the first alphabet B. If something below South is mentioned, I take the next alphabet, and that is paracoccidioidomycosis. Okay, America story a lot done, but if you forget otherwise, Paracoccidioides brasiliensis, Brazil, South America, that's another way of students learning it. Now finally, what do I see? In paracoccidioidomycosis, I see a lot of PPMM. What is PP and MM that we are talking about? So P will remind me of paracoccidio, shows me, can you see this is looking somewhat like a pilot wheel? It is looking somewhat like a pilot wheel appearance. Instead of a pilot wheel, you want to call it a mariner's wheel, you can. It's showing you the pilot or the mariner wheel appearance. And what is it showing you other than that? It sometimes shows you the Mickey Mouse appearance also. Very, very common question asked. That's why I said PPMM. What is PPMM? P for paracoccidio, P for pilot wheel, also known as MM, also known as mariner's wheel, also showing you the Mickey Mouse appearance. So paracoccidio is going to be PPMM. Having said that, after para, you cut the word para, you are left with what? Coccidioidomycosis. Coccidioidomycosis is caused by Coccidioides immitis. Coccidioides immitis. And remember, if you want to learn this within a second, you have to learn something known as ABCD. So the C is very, very obvious that I'm dealing with the organism Coccidioidomycosis. So C means for that, but D will tell you the other name. Remember, this is known as desert rheumatism. So which desert will they give you a history of? See, look at this name very carefully. Either there's going to be some desert, or there's going to be some California valley mentioned. So see, some desert like Arizona. I told you this is all California, this is all US related. America, dimorphic fungus has a long way to go. Okay, so remember desert of Arizona will be mentioned, or some valleys of California will be mentioned. And what is the meaning of rheumatism? Because rheumatism will tell you that there is an element of joint involvement, which I have not told you for any other dimorphic fungus up till now. There's an element of joint involvement, or there can be migratory polyarthritis also that is noted. So yeah, that is what you have to know over here. So simple, if you learn the word desert rheumatism, you know desert of Arizona, and rheumatism is going to be for joint involvement. What is A and B? Please remember, A and B stands for barrel-shaped arthrospores. B for barrel, A for arthrospores. So first and foremost, this is the same picture I had shown you in the beginning of the chapter, and that is these are the barrel-shaped arthrospores. Please remember these boxes that are formed over here. This is the very famous barrel-shaped arthrospores. And why is it blue in color? Because I can see the very famous lactophenol cotton blue. Now, having said that, moving on, what else? I can see these structures, these round structures again with spores inside it. So yeah, that is also a possibility that I'm going to see spores inside these round structures. That's one sort of picture. And the other one is the barrel-shaped arthrospore. So like I said, for coccidioidomycosis, A, B, C, D. What is A and B? A and B is going to be for barrel-shaped arthrospores. C is coccidioidomycosis. D is going to be desert rheumatism. Desert means some Arizona desert or some California valley, and rheumatism is going to be joint involvement. Now, coming all the way back, obviously, again, reminding you of the treatment. Treatment for all of them is going as what? It's the same azoles which are being given if it is a mild treatment. And if it is a disseminated treatment, then how are you going ahead? You are first giving a round of amphotericin B, and then you are going on to the azole. So the treatment is remaining the same. Coming to the end, body heat probably changes shape, and this is sorted for you. What is that shape going to remind you of? S is going to be for sporothrix or sporotrichosis. Do you remember S was also a part of MRCS, the subcutaneous infections? So can I say that not only is it going to be a dimorphic fungus, but that subcutaneous skin involvement? So I realized that all of these, no matter what I studied up till now, all of these were primarily involving the lungs, primarily going into the lungs. But sporotrichosis is something that is now going to involve the skin, and that is what makes it different. So I've kept the different one for the end. Before I start with sporotrichosis, the end is going to obviously be, so the end of your medical profession. When I say end, I mean when you stop studying finally one day, which is actually never going to happen. But yeah, when you stop giving all these exams, NEET, FMG, INI, CT and all, the day you stop giving all these exams, that is when apparently a good life is going to start. So what is the definition of a good life, if I may ask you? So the definition of a good life is that you don't have to sit in a 6x6 room, or you don't have to sit in a library. You can roam around, you can move out in the fields, you can enjoy nature. So for nature, they have told you that you are roaming around in a field, there are roses, a bed of roses. Good life will be when you are walking on a field of roses. The good life will also be when the area is open, means you can see the stars in the sky. When obviously people like us who are living in Delhi, where you have the worst AQI possible, we never hardly nowadays get to see stars. But yeah, the good life will be where the sky is clean and you can see the stars. Also, another description, if you've seen the Hollywood movies and you know that the good life is always when there's a cigar in your hand. So yes, the cigar in the hand is the depiction of a good life, which I want to tell you is not. But yeah, having said that and preaching that life, that habitual lecture, let me tell you that cigar is something which is said to be good life. So good life will be walking on a bed of roses, looking at the stars up in the sky and having a cigar in our hand. That is the future good life we are working towards. Sporotrichosis is living the good life. Be extremely jealous of sporotrichosis. Now let's start. Which organism am I talking about? So sporotrichosis will tell me that I am talking about Sporothrix schenki. I am talking about Sporothrix schenki. Next, why did you call it? What is the other name? It is known as the rose gardener's disease. So see, the story of rose has come. Why do you call it a rose gardener's disease? Because they will always tell you a person who's working with the rose bushes. Rose bushes means that if there are roses, there will always be a thorn. So they will give you a history of a thorn prick that is going to be there. Now, when there is a history of a thorn prick, you will see that there will be a lesion. Initially, there can be a pustule, there can be an ulcer, there can be involvement of a nodule. So many types of lesions can occur, but whatever will happen at the site of the prick, okay, the trauma. After that, we realized that this is the region where the prick occurred. But apart from this, we saw there were lesions which were spreading like this. They are going in a line. Why are they going in a line? Because look at the other name. It is a lymphocutaneous disease. So remember, you will start seeing there will be nodules along the lymphatic channels. There will be nodules along the lymphatic channels, and that is one of the most important histories that they give you in the exam. They will give you that there is a nodule at the site of the rose thorn prick, and along the lymphatic channels there are multiple lesions that are going to be there. Now when I say that, let me tell you the good life, because coming back, the rose part of the story I have understood how the rose is causing the problem. Let me look at this under the microscope. Now comes the story of the cigar, the story of the stars, because when I look at this under the microscope, microscope, the first thing that I see is this very famous, you can see a star-shaped body, right? So what is that star-shaped body? That star-shaped is nothing but the asteroid body. So this star-shaped body is referred to as the asteroid body. You must be wondering, what are these pink lines? What are these pink lines that you're seeing over here? So this is now known as, I think you know about this already. This is referred to as the Splendor-Hopley phenomenon. This is referred to as the Splendor-Hopley phenomenon. So what do I mean by Splendor-Hopley? I have told you, where else have I taught you Splendor-Hopley? We had studied it in actinomyces, remember? And over there also I told you this was the famous antigen-antibody reaction. So Splendor-Hopley phenomenon, 2 places. Quick recap, Splendor-Hopley phenomenon is known with actinomyces, and Splendor-Hopley phenomenon is also known as sporotrichosis or Sporothrix schenki. But there are a lot of other organisms that can show you it. There's no end to learning it. These 2 are the most important ones. But if you're talking about an antigen-antibody reaction, where is the antigen? Where is the organism? The organism is in the center. So this round thing in the center is the yeast, and this round thing is known as the cigar body. So remember, the organism is in the center round thing. So cigar is obviously going to be like this, but they've shown you a cigar like this way. So it's looking like a dot, right? Instead of showing you a cigar like this, they've shown it to you like this. So please remember, you're seeing it as a dot. So that yeast, that organism is the cigar body, and around it, all of this starry thing that you've got, that is the asteroid body. So you've seen the stars, you've seen the cigar. Coming back to the rose, when you look at it under lactophenol cotton blue, can you see another rose-like thing is formed? What is this known as? This is known as rosettes of conidia. Again, another rose coming. So like I told you, this is the rose gardener's disease. Everything about it is to do with the roses, right? Everything about it is going to do with the roses. So we see the presence of rosettes of conidia. So let's do a recap. Why did I call it the good life? Because firstly, you see the presence of rose. So it's a rose gardener's disease, lymphocutaneous disease. You see rosettes of conidia, cigar in the hand, so a cigar-shaped body, stars in the sky, so an asteroid body. That is what you need to know about sporotrichosis. And yes, having said that, please remember the treatment is again going to be the azoles like you studied throughout the dimorphic fungus, that is itraconazole. But before I end and I go on to the summary, is there anywhere else in medicine or path or micro where you have studied the same asteroid body? It's going to look like the same asteroid body. So now let us do a recap. Please remember that this was an asteroid body. So asteroid is what? See, asteroid is going to be a star, right? Asteroid refers to a star. So stars are seen in 2 S's. The first one that I taught you over here was Sporothrix. The first one was Sporothrix schenki, number 1. And the second one is an S that you see in the lungs very commonly, many other organs, but very commonly called as sarcoidosis. How do I differentiate? Because the Sporothrix is also looking like a star and sarcoidosis is also looking like a star. Please remember, the star in Sporothrix schenki is extracellular and the star in sarcoidosis is intracellular. How will I learn that? So first and foremost, remember, which cell, inside which cell am I saying? See, as far as I remember from our pathology lectures, sarcoidosis shows you a granuloma. Remember, non-caseating granuloma, and if I'm saying granuloma means it's going to show me a giant cell also. So actually what you're seeing over here is a big giant cell. See, look at the number of nuclei. It's got so many nuclei. So this is actually a giant cell. And can you see there is a star inside a giant cell? This is an intracellular star. So if you're seeing something inside, it is the sarcoidosis wala star. But if you're seeing something outside, lying outside, out in the open, the star is just lying out in the open, that is Sporothrix. How do I learn which of them is living the good life out in the open? Remember, again, coming back to the same thing, sporotrichosis, Sporothrix schenki, the rose gardener's disease. He is the one who's living the life and who's roaming around outside in the rose garden. So yeah, that is, since he's roaming around in the garden, the star is also going to roam around outside only. So this is going to be the extracellular asteroid body, whereas sarcoidosis will be the intracellular one. With that, body heat probably changes shape. That's an end to all your dimorphic fungal organisms, and that means we are ready for our final summary. So yes, along the summary, you have body, heat, probably two things, and changes and shape, right? Having said that, let's start. You have to tell me their other names and quick revision of all the things that is regarding their images. When I talk about blastomyces, do you remember this is known as North American blastomycosis? And regarding North American, I told you that this is also going to have two other names. This is also known as the Chicago disease, and this is also known as the Gilchrist disease. How did you identify blastomyces? B for B. So because B looks like an 8, we identified it by the very famous figure of 8 appearance. Coming to the next, histoplasmosis. I gave you a mnemonic. Histoplasmosis high. So it had to be high Darling. Remember, there is something called Ohio's disease. There is something called Darling disease. And because it was also to do with the bird and the bat droppings, so it was occurring in caves and it goes in macrophages. So it is reticuloendotheliosis. If you remember, this was very similar to TB. This was TB Jessa fungus. So if you zoom in and see which kind of macroconidia were you seeing, could you see these? Tuberculate, very famous tuberculate macroconidia. So if you remember these two pictures, this was the form that was the yeast form, and this was the form that was the tuberculate macroconidia. So please remember this very famous thing. The histoplasmosis shows you tuberculate macroconidia. Moving on, Penicillium marnifi. No one's gonna forget that. Firstly, the other name, the new name for Penicillium marnifi is what? Talaromyces marnifi. And what all did you have to know about it? Marna. Whom are you going to hit? You were hitting the bamboo rats. Remember, rats or bamboo rats were the reservoir. You were hitting them till the time their color was becoming red. And what were you hitting them with? You were hitting them with a broom or a brush. So it was showing you the broom or the brush appearance. Coming to the next, paracoccidioidomycosis, which is finally known as South American blastomyces. It is known as South American blastomycosis, and it shows you PPMM. What was PPMM? Paracoccidioidomycosis shows you the pilot wheel appearance. What was the other name for pilot wheel? It was known as the mariner wheel appearance, and then you had a Mickey Mouse also. It was also showing you the Mickey Mouse. So pilot wheel, mariner wheel, Mickey Mouse, same thing. Coming to the next, coccidioidomycosis, that had a very famous mnemonic, that is ABCD. If you remember, C was for coccidioidomycosis, D was for the other name. It is also known as desert rheumatism. Desert rheumatism. Desert will tell you some Arizona desert history will be given. Rheumatism will tell you some joint involvement will be given. And what is the other picture that you have to know? B and A. So what arthrospores? This picture that you're seeing right over here, we can zoom in and see it alongside. So you can very well visualize over here. I see the presence of barrel-shaped arthrospores. So remember, barrel-shaped arthrospores. So the B and A was standing for barrel-shaped arthrospores. Finally, coming to the last one, sporothrix. When I say sporothrix, he's going to live, I'll just write one thing in front of it, which will always remind you that he's living the good life. Means firstly, this is something to be seen with rose gardeners, right? You will see something related to rose. Similarly, what kind of conidia will you see? You will see the rosettes of conidia. What body will you see? We will see the very famous star-shaped body, that is asteroid. Who is in the center of the asteroid? We have the good life cigar. So the cigar body is also going to be seen. So that's a very quick 2-minute recap of all the dimorphic fungal organisms. Body heat probably changes shape. Having said that, let's now, I think we are ready to practice a few questions on the dimorphic fungus. So let's begin with the first one. Which of the following fungal organisms is most likely to be found in the reticuloendothelial system? Reticuloendothelial cells. Which was that one where I showed you a picture? I think everyone remembers that is going to be the famous histoplasma. Remember, it is known as Ohio's disease or Darling's disease or reticuloendotheliosis, also known as the bird and bat, so caves disease, right? I hope you guys, I told you that time also, it's one of the most frequently asked questions. Coming on to the next question, coming on to this. Okay, this is something which could have come from probably anywhere. A wedge-shaped perforation of the hair is found when the hair perforation test is done. Which of the following infection shows you a positive hair perforation test? Trichophyton, Exophylla wernicki, epidermophyton, or all of the above? This is obviously not from dimorphic fungus, but yes, I'm just making sure that as you're moving forward, you're not forgetting what you did earlier. If you remember, hair perforation test was to differentiate Trichophyton rubrum from Trichophyton mentale. mentagrophytes. So basically, what you were using it for is going to be trichophyton species. I don't see any trichophyton species except the first one. Trichophyton is there, and which of them was showing you a positive hair perforation test? You remember the mnemonic? So when we wrote trichophyton, mentagrophytes, what had we learned? We had said men are fighting and they are going to fado, that is, they are going to tear apart each other, right? So perforation is going to be done by men fighting. So the positive hair perforation test was by mentagrophyte and rubrum was showing you negative. So over here there is no such option, only trichophyton is written, so I'll select that. Moving on to the next question. There's a girl who has pricked her finger while working with the rose bushes. I think I've got my answer. She develops a local pustule that progresses into an ulcer and several nodules that develop along the local lymphatic drainage. So first I told you there is something called the rose gardener's disease, and the method of spreading of that rose gardener's disease was lymphocutaneous, and all of that is mentioned so beautifully over here. So we've got the cutaneous involvement, we've got the lymphatic involvement, we've got the garden history, the good life. Garden history, good life means I'm talking about Sporothrix schenki. Coming on to the next question. Okay, so let's see which of the following statements is true for the direct examination of sputum or tissue sample taken from coccidioidomycosis. So for coccidio has been mentioned. Okay, so let's see. So the first one is saying that you are going to see identification of yeast with its pseudohyphae. Do you see pseudohyphae in coccidioidomycosis? No. Pseudohyphae is a very important feature of candida. So this is the wrong statement over here. Next, the detection of spherules with endospores in it. Did I show you some spherules with endospores in it? Maybe yes, it is possible. So let's consider it as a true statement for the time being. Now we have to read the next. The saprophytic phase is observed as septate mycelium with pyriform conidia. No, that is not something that we had studied. We had studied barrel-shaped arthrospores. So that is again wrong over here. Okay, so next. So this is wrong. This is wrong. Last one. Tuberculate macroconidia. Tuberculate macroconidia are observed in culture. No, as far as I remember, the TB word comes and the fungus that I think of is histoplasma. So that is also wrong, which is the true one. The right one had to be picked up. I feel the second one, where I am seeing spherules with endospores, that is definitely the one that I can see with coccidioidomycosis. Remember ABCD? That was coccidio. Moving on to the next question. Okay, so let's start reading this. You have a farmer in the Midwest of America who has developed flu-like symptoms with fever, headache, muscle pain, cough for a week. So typical flu symptoms. Swab specimens and the sputum sample were taken. Radiographic examination was performed, which showed diffuse bilateral pneumonia. After a week, the mold culture colonies were observed with large and small macroconidia. Name the possible pathogen which the person has been exposed to. So first and foremost, let me go into a little bit of detail. When I'm talking about blastomycosis, are they going to talk about blastomycosis in terms of conidia? No, for blastomycosis, they'll write figure of 8 appearance, which is not mentioned. If they would have been talking about sporotrichosis, that Rose Gardner's history is missing. That is totally ruled out. So when I'm talking about in terms of, what is going to be the answer, we either have an option of coccidioidomycosis or we have an option of histoplasmosis. Now, as I see over here, coccidioidomycosis should have been the ABCD history. When I say ABCD history, that means that there should be firstly a desert history, something like in Arizona mentioned, and barrel-shaped arthrospores should be mentioned, which is again not the case over here. So when I talk about the Midwest of America, Ohio definitely comes to my mind, and when I say Ohio, that is going to be histoplasmosis. And can histoplasmosis come to you with large and small conidia? Yes, the large one, I know the name also. The name of the large one is going to be the tuberculate macroconidia, right? So yes, they're very much possible, and there will be microconidia as well, and Ohio is fitting very well, so this is the answer. Coming on to the next question, a simple one. Barrel-shaped arthrospores are seen where? So I can very well see that there is a mnemonic called ABCD. Barrel-shaped arthrospores are seen in the desert rheumatism or coccidioidomycosis. You can see the barrel-shaped out here. Very, very simple to identify. Okay, let's pick up 2-3 quick one-liners. Look at this question. Where do you see the cigar body? Cigar, the good life. Cigar, an asteroid. So the cigar body in the center and the asteroid around it. The good life is going to be Sporothrix schenki. But where did you see the sclerotic body? Where did I teach you sclerotic body? I'll give you some other hints. Sclerotic body was also known as the medullary body. Sclerotic body was also known as the muriform body. It was also referred to as the everyone's favorite copper penny bodies. Where do you see that? So that was a twist I wanted you to recall from the previous section. That